mandizibulisele kumntu lapha endlini. Sizawuqala besamele nje ba kubekho abanye abantu abafikayo sibe nokwazi uqala, but in 2 minutes sizawuqala. But phambi ba siqale siza kwenza into ezimbini. Ndizawucula ingoma isunovuka asiyalezele kusombawo nje quick ukuba silapha kwenzela into ukuthi yonke into esixoxa apha sixoxe izinto ezingeyontando yethu but zikhatshwe ngumoya engcwele. Andaba siyayazi la ngoma ithi hayi sekuseleka kancane sekusele kancane kancane sizophumelela hayi sekuseleka elimpompo sekusele kancane Eastern Cape sizophumelela Emtanzane sekusele kancane lusikisiki sizophumelela kancane sekusele kancane kancane sizophumelela kancane sekusele kancane kancane sizophumelela Emthatha sekusele kancane Alfred Inzo sizophumelela kancane sekusele kancane kancane sizophumelela amandla over to you mfundisi.
Enkosi manibulele ngelithuba nkokheli yami ndibulele uThixo osivusileyo kwimandlalo ngemandlalo zethu sazoba khona kulona umhlangano namhlanje. Siyazi into yoba yonke into sayiqala sizayiqala kunye noThixo. Kumnandi uba sithi uyasiambusha nje uthathe ngokuthi siye kungabikho kwanto. Comrades as my Afrikaans goed was yabo benza ke probeer in Afrikaans. Five of his brothers zisuka kwelo lizwe zazisuka kulo bazozibeka bazobonwise ithi ngesixhosa wathatha babahlanu wazobabeka apha phambi koFaro wabakhetha ke zangathathe nje kuthiwa in Afrikaans yet faith van sy broers saamgebring ne voor Faro uFaro het hele 4 boere ons en ons voorvaders singabelusi bempahla emfutshane thina kunye noba womkhulu bethu atsho la madoda amahlanu ayayazi uFaro ufuna ubabuza ngale mini bafika ngayo bebayi5 ukuthi uyintoni na umsebenzi wenu so that umuntu azozazi ba uyintoni na umsebenzi wakhe. Silapha kule community meeting ukuthi ubani nobani azifunde into ba what's your occupation ungabambi into ebanjwe ngomnye umuntu uyintoni umsebenzi wakho likhona igama obizwa ngalo kodwa wakho umsebenzi wena kukroba ngefirst year angomsebenzi wakho lo kuhlekisa ngabantu kunye nezigulo zabo ayingomsebenzi wakho lowo uyintoni umsebenzi wakho xa kunzo wakho umsebenzi kukhusela ababantu masingathi xa singena apha kwezilokishi zethu sityiwe zizinja sityiwe nangabantu size santhi xa nisibona singena kwabani nibe nencoko emveni koko ningabahlali ayingomsebenzi wenu lowo uyintoni umsebenzi wenu masambe ensongeni ke namhlanje siyoqonda umsebenzi wethu ubuyintoni na ingaba lento sizimisele ngayo mamseli ngumsebenzi wethu na isenokanti sispend ixesha elide ngokheli yami kwizinto ezingomsebenzi wethu uyintoni umsebenzi wethu masambeni ke ngoku siyokwenza umsebenzi wethu masivaleni amehlo ke sithandaza egameni loyisene lonyana nelomoya oyingcwele baba uThixo somandla mdali wezulu nomhlaba silapha ke phambi kwakho ke Thixo wena ubuyazi le mini ubusazi uba izawufika ekugqibeleni Thixo somandla liyafika ithuba lokuba sisizwe sifunde ukuzimela sifunde ukuzenzela sizibange Thixo izinto ezimele uba zezethu sizibange moya oyingcwele izinto ezizezethu sizisebenzise sizazi uba singobani na la madoda sithetha ngawo kweli lizwi ayazazi azinoyise noyise babe ngobani babesenza ntoni na ngokuthi nathi umane uhlala usikhumbuza uba singobani na kwaye uyintoni umsebenzi wethu sifuna ntoni kule ndawo ingathi kanti moya oyingcwele sihamba nje sizocela wena ke ze kuthi kuko konke sizakwenza ngayo le mina namhlanje kuphuhle kuhlala ezinhliziyweni zethu kube sisikhumbuza uba ngenye imini sakhe sayema kulona umhlaba waseBrayilini sazomisa isimiso zazi into yoba wonke umuntu une-obligation to play his or her part.
Siqala ikhona enye ingoma for 2 minutes. Ithi le ngoma kodwa yini socialism i-treatment ezibhedlele zabantu akunamuntu ongathola khona makhambi sibambile maqabana ithi liyabuza le ngoba yintoni i-socialism sithi i-treatment ezibhedlele zabantu akunamuntu ongathola khona amakhambi sibambile maqabana kodwa ini socialism i-treatment ezibhedlele zabantu akunamuntu ongathola khona makhambi sibambile kodwa ini socialism i-treatment ezibhedlele zabantu akunamuntu ongathola khona makhambi ayesaba mabhutshwa onxiwa ngoluma babefuna ukusetyenzelwa ngabantu amandla xa sinexesha sizayifundisana le ngoma mandizibulisele kumuntu wonke olapha ngaphakathi endlini kubahlali ndizibulisele also kwi-members ezisuka kwi-Department of Health at a district level, at a provincial level, at national level. I also want to greet colleagues from PEPFAR, UNAIDS, CDC, USID, as well as the district support partners. And I also want to greet community members who are not here in the room with us, but who are watching this from various viewing points across Eastern Cape and in South Africa. We've got a lot of people who are watching this meeting online, including people from the Department of Health. I do not know whether our comrade Mlungis from the Office of the President managed to attend, but I spoke with him and invited him to come and listen. My name Dingu Anele Yawa, Dingu General Secretary of Treatment Action Campaign and the Chief Accounting Officer of Ritshidze. I've got my comrades next to me, whom I will allow them to introduce. Okay.
Molweni, Dingu Belinda Sichugelo, work for the Treatment Action Campaign in the Ritshidze project. Thank you.
Molweni Ngokele Ndungu Akhona Ntsaluba. I work for TAC in the Ritshidze project, but I'm also Mele Omama at a national level. Thank you.
Molweni, igama lam nguLuthando Sono. I work for Ritshidze as a key population organizer, and I'm a trans woman. My pronouns are she and her and hers.
Thank you. And also in the room, I want to acknowledge Usonwabile Mango, Osuga from Wimatch, Oyi project team leader. Also, acknowledge house manager with DOH from BCM, Useli. My apologies for calling your names because it's not written whether it's or what. Yes, but also I want to acknowledge Tabisa Qineli from Sinako Wellness and Development, and Pumla Madliwa from Living Hope, site coordinator. There are others abafike late. Nabo siyaba acknowledge ngokulinganayo. Siyavuya ukuba kunye nani with hope yokuthi sizaphathisana. They acknowledge people in the room, people living with HIV. They acknowledge in the room the LGBTQI community. They acknowledge in the room the majority of the public healthcare users who decided to come here and join us and be part of this meeting. Colleagues, nzamana ke ndithetha iConglish, demand mixed isiXhosa nesingisi, because as I've said, there are people who are online, but it is in the best interest for umuntu wonke lapha endlini ukuthi you are not forced to speak English. Thetha le language ikuvisa kamandi ube nokwazi upasa message. Let me also acknowledge and welcome comrade Uthando Xolodogo. Uthando Xolodogo is working for USAID. He is one of our own. We claim him. He is part of the struggle, even when he is on that side, but he knows ukuthi he belongs to the people, and all of us, we belong to the people, and we have to serve the people. Ladies and gentlemen, comrades and friends, this is not going to be a long meeting. There will be videos esizazidlala pha, and also recommendations. Also, abahlali will come and share their frustrations on how is the healthcare system of our country failing them. How is it violating their constitutional rights? How is it making them to feel ukuthi they are no longer human beings who've got the rights to be protected and dignity to be safeguarded? Today's meeting, comrades and colleagues, is not about pointing fingers to each other and apportioning blame. We've got a problem in South Africa, colleagues. The problem is now in South Africa. Yinto yokuthi sinabantu abayi more than 80 million abaphila kunye negciwane lengculazi, and about 5.8 of those people bakwi treatment as basithetha nje. But out of that 5.8 million people, sinabantu abaninzi abakhetha uyeka i-treatment ngenxa yezizathu ezininzi. And ezizathu zibangela ukuthi bayeka i-treatment, ezinye zazo azilungiswa pha eclinic. Zisibangela ukuthi ngokusikhethe into ukuthi sihlale emakhaya singayi eziclinic until iclinic ibe nokwazi ulungisa ingxaki zethu. I'm not going to mention them, but they are here. And eyona worry sinayo ke ngoku sector of people living with HIV, into yokuthi i-country is moving towards the NHI. And there are many people in the private sector who are saying this NHI is not going to work because look at what is happening on the response to HIV. And some of the officials in the department, they give those people who do not want the NHI to be implemented a weapon to fight against our government. Because if we've got more than 400,000 people living with HIV who have disengaged on care, it therefore means we've got a problem. If as the country, we've got the new ART guidelines that are not yet implemented across the country, we've got a problem. If we still have facilities that are giving people living with HIV 1 month treatment, yet the policy talks about multi-month dispensing of medication, we've got a problem. If we've got differentiated model of care, standard operating procedures, ezithi, abantu who are collecting treatment, kuma pick-up points, treatment yabo must be there for 28 days in order for them, when they come back, they get it, and it is returned back to the facility or the pharmacy within 7 days, we've got a problem. If we've got these huge numbers of abantu bakuthi abakwi treatment, and the LGBTQI xa besezikliniki beyotesta beyofuna treatment discriminate, stigmatized, benziwe inhlekisa. We've got a problem. We've got a problem which needs to be sorted out. And if that problem is not sorted out, many people are going to die. I want to say it here, colleagues, that we as Treatment Action Campaign and other organizations of people living with HIV, we fought against our government. We fought against Thabo Mbeki, Nomando Chabala Msimang, who said we must go and eat beetroot. And we said ARVs are here. They are going to save our lives. Therefore, when people are not given treatment and people are defaulting on treatment, you must know that you are touching our nerve and we want to relax. And we can't keep quiet. If when you move from eBloemfontein apho buphangela khona ubuyele eMdantsane xa usiye clinic kuthe basokunika treatment sifuna transfer letter sifuna ID, and then if facility decide about you go away and die because of a piece of paper, therefore we've got a problem. How do we work together to make sure that these problems are resolved? If uAnele missed the appointment yakhe yokollecta treatment yakhe e-clinic ngomvulo because bekunetha nangolwesibini nangolwesithathu, and uAnele uyayazi ba iclinic yakhe incinci, and if uvukile emvuleni womaphandle eclinic uzonethelwa, decide uhlale ekhaya ide ithomalala imvula, xa ngolwesine ndisiye eclinic ndivuke ngo7 o'clock ekseni unesi andixela uba you missed your appointment, akafuni oyazi, go and stand right at the back of the queue. Yet onesi bona xa bene appointments zabo nogqirha nezinye indawo bayimiss appointment bafuna understand. But we people living with HIV and the public healthcare users, when we miss these appointments, we are ridiculed and made no bodies. It means we've got a problem as the country. And we cannot continue to point fingers to the politicians. The MEC is not the one who is delivering medicines at the facility level. The minister is not the one who makes sure that medicines are purchased and made available. Somewhere, somehow, xa ungumntu omfutshane njengam, Comrade Thando Xolo, yabo ndimfutshane, xa ndifuna xa ndiphambi komntu weapile, ndifuna iapile, ndingenayo ileri, ndawushukumisa umthi kwenzela uba azwele ama-apile. Comrade Thando Xolo, I'm sorry for mentioning you. I am tired of these meetings. I am tired of these meetings. And I told the Minister of Health, even the DG, I am tired of these meetings because we find ourselves resolving the same problem repeatedly. Since 2018, we are no longer toying, we are no longer occupying offices of government because we feel good, let's engage. Just Sunday, Comrade Thando Xolo, I received a WhatsApp, a voice note. Uthi kum ubrother wam besebenza eLimpopo wadefaulta eLimpopo waphela umsebenzi ugodukile ngwangapha eTinarha suke eTinarha mina kwanobuhle but ndiseJoburg. Uthi lo mama ubrother wam beyile clinic eSilvertown clinic wajikiswa because bengenayo transfer letter. And I said, see, Monday morning ubrother wakho must go to the clinic. I picked up a phone and called Mrs. Sonia Lupondwan, the district manager of Nelson Mandela Metro, and I told her that this person needs to be assisted as a matter of urgency. Yesterday morning, 8:30, I received a message, we told treatment, but ufumene only 1 month supply. But the question we must ask ourselves, how often must we do these interventions? Go March this year, they were striking, closed the clinics. We were denied access to healthcare services because they fought for a salary increase and other benefits that have to do with medical aid. They are disrupting and destroying the public healthcare sector, knowing it very well that they can afford to buy healthcare services with private. I said in Free State, and I'm saying it here, Akona, Noloyiso, and everybody who is here, who is a TAC member. Next time, when unions or nurses strike as the Valley Clinic, Ritshidze, you must organize taxis and buses. Take all those people from our clinics to the nearest private hospital. We've got a constitution in this country. Section 27 of the constitution does not talk about private or public. It talks about access to healthcare services for all. If our clinics are closed by the same nurses who are ill-treating us in our clinics, they close them because they want an increase for this and that, let's go to private, occupy the private, so that all of us, we can suffer. As we are talking now, we are told that the Department of Health has a deficit of 10 million because of the agreement and the promises they made to the unions. That money, which is going to be paid to them, is going to be taken from the money that is meant to build our clinics, to hire more nurses, to buy ambulances, to buy medicines, to fix the roads. It is going to be taken to the same people who are ill-treating us. In those ways, I'm trying to say, colleagues, sibuseni ingqondo zethu sibe lapha kwenzela basiyazi ukuthi xa sisiye clinic, whether ungumuntu omdala, ungumuntu who is living with HIV, you are gay or you are lesbian, when you go to a clinic, you must know ukuthi nobody is doing you a favor by being at the clinic. Ezinye clinics up around Buffalo City nakumaBhayi, on Fridays they don't give treatment to people. And I'm asking myself, what are the officials doing about that? Because as far as we know, clinics must be operational from 8 a.m. to 4 a.m. Monday to Friday. But when you go to other clinics after 2 o'clock, you are turned away. These are the things that we are experiencing as poor people. And every time and again, we keep on blaming government. Government is not doing this. When are we going to name and shame these officials who are ill-treating us as people of South Africa? So, that's why we have invited the officials from the department to listen from you, so that singabi general bangabana enolungile clinic going go Friday ayikhutshwe clinic, say it here, so that we can report to officials at district in order for them to go and witness what we're talking about. And they will be in a position to understand why, as the country, we've got a high number of people living with HIV who have disengaged. Because if we are clinic after 2, you won't get a treatment. If you go Friday, you know ukuthi uhambela ilize. Thank you. On that note, without making further State of the Nation address, I will also, there are organizations that are here of people living with HIV in Napwa, imelwe nguRev Novuka, i-Positive Women's Network, imelwe nguNcedisa Zinyane, iSanarela, imelwe nguNobesuthu Skeyi, i-Treatment Action Campaign, imelwe ngobuntu Maqheba. So, also kamaqabane la azawuthela ningafani nami xa ningizela i-testimonial, sibe short and brief. Kwenzela basonke sibe nokwazi uba nexesha enough sithethe singekadini. On that note, I will hand over to Comrade Belinda. I'm sure all of us, we do have a program. A program here to about issues of staffing and waiting times. Sitete about issues of ART collection. Sitete about ART continuity, issues around key populations, index testing. Sitete about issues related to infrastructure and conditions of our clinics. And lastly, we will talk about ETP, infection control. Then after that, we will give enough what TAC colleagues 3 minutes, and then sending is a good Department of Health respond. If maybe there are district support partners like UMatch, if they want to come forward, they can respond. But you know, I know we are frustrated, we are angry. Please, man, sing a tukanin, as big J issue, the way is the. Are we together, comrades? Amandla, Amanga. Over to you, Belinda.
Okay. So today we are launching the 3rd edition of the State of Health Report for Eastern Cape, developed using the Ritshidze monitoring data, which take place quarterly basis in 46 facilities across the province. This week, we'll dive deep into the data collected across into 2 districts in the province. This presentation will focus on the facilities as a Buffalo City, which we are monitoring, and they are 11. all in all. In addition to the 11 facilities monitored in BCM, we would look at quantitative and qualitative data, which is collected in communities specific to the quality of services for people who use drugs, sex workers, LGBTQIA plus community members. The data collected through observation as well as interviews with healthcare users, public healthcare users, people living with HIV, key population, and healthcare providers, which includes the facility managers and the pharmacists. Okay, so in addition, the report that we are presenting today is the data which was collected in Q4, as I've alluded, and it's our Q4, it's July to August of 2023. The interviews took place with 11 facility managers. We also did observation in 11 facilities. And the interviews took place with 620 public healthcare users, which 50% of those identifies as people live with HIV, and 21% identifies as young people under the age of 25. In addition, we collected the data between July and September amongst communities of key population, which took place among 191 gay, bisexual, and other men who are having sex with men. And we also interviewed 115 people who are using drugs, and we also interviewed 16 who are sex workers. So the first group of issues will be on on staffing and waiting time. According to 617 public healthcare users, only 4% thought there were always enough staff to meet the need of public healthcare users, down from 6% last year. Improving the state of healthcare services provided at clinic so that all people who are living with HIV and key population can access friendly, welcoming, and quality services depends mainly on having enough and committed staff in place in our facilities. Yet this year, only 4% of public healthcare users interviewed reported that there are always enough staff in the facilities. This has worsened slightly since last year. It was 6% of people who said there were enough staff in the facilities. From the perspective of facility staff, 0% of facilities monitored reported there were enough medical and non-clinical staff to meet demand, down to 17% last year. There is still a way to go to fill the human resource gap, as 100% of facilities monitored remain with too few staff to meet demands. Of facilities reporting shortages, 13% of facility managers blamed there not enough being open positions on staff shortages, while 50% blame staff shortages on one or more unfilled vacancies. According to facility managers, the most commonly understaffed cadre were enrolled nurses, adherence club facilitators, professional nurses, enrolled nursing assistant, and pharmacy assistant. The number of vacancies in Buffalo City is similar to last year, at 50 positions now in the facilities we monitor. The highest number of vacancies by cadre are professional nurses, enrolled nurses, pharmacist assistant, and data capturers. 80% of facility managers we spoke to specifically wanted additional human resources for health support from PEPFAR district partner, which is MEDS. However, partner funding for critical HR posts has only been reduced in the recent years. Average waiting time have reduced by just under an hour in the last year in facilities monitored in Buffalo City down from 4 hours, 7 minutes to an average of 3 hours, 16 minutes waiting in the facility before the facility opens. And waiting time after the facility opens reduced from 3 hours, 57 minutes, which was last year, to an average of 4 hours, 7 minutes after the facility opens. Some facilities has waiting time over 3 hours and as outlined on the table above, with some waiting over 4 hours. This means that some public health care users still spend hours in the facility, and this is a major source of dissatisfaction for those who experience the long waiting time. 69% of public health care users interviewed in the province think the waiting time at the facility are too long. This has improved slightly since last year, where 75% of public health care users thought waiting times were long. 95% of public health care users blame long waiting time on staff shortages, and 13% blame staff not working or working slowly. While 97% of public health care users were aware of the clinic appointment system, only 25 report getting both a date and time, and 73% reporting just getting a date. This means people arrive early in a cluster in order to be seen, and clinics are empty by the afternoon. Appointments could be spaced throughout the day to ease the congestion. Filing systems were observed to be in good condition in 64 of sites monitored, down to 80% last year, mostly due to filing rooms being too small to maintain. Messy and disorganized filing system increased delays and increased the burden on already overstretched healthcare workers. The average earliest arrival time has improved slightly from 6:06 a.m. last year to 6:15 a.m. this year. However, people still begin queuing early in the morning in an attempt to get seen more quickly. 2 facilities monitored still have an average arrival time of before 6 a.m. Of 262 people who arrived before the facility opened, while an improvement from 70% last year, is still 52% reported feeling unsafe, very unsafe, while waiting for the facility to open. While a circular was issued in May 2019 by the National Department of Health calling on facilities to open at 5 a.m. on weekdays, none of those monitored even opened before 7:30 a.m. Commonly, facility managers tell us that they are unable to extend working hours due to insufficient staff to cover this time. Now we would move on to the recorded community stories. Thank you.
Ufika phayana khase noma ungabhalisa ekuseni okusalayo uyakwazi umntu ungakhange uncedwe. Abanayo i-sense of urgency, abanayo into yoba lo mntu uxhaliseke kangakanani na, okanye ugula andazi ayibeka kanjani, but abanayo loo nto. Umuntu ubona lo mntu afuna umbona ngelo xesha afuna umbona ngalo. Bakhona nabafikayo bancedwe ngokuba ukhona nawe. Ubuze kubani ngaphamba umuntu asekhaya ufuna uzithukisa.
They go to lunch. Everybody goes to lunch. Acute, where they take the blood pressure, the chronic sisters, so there's no movement really. But now 3 o'clock comes, it's tea time. We're still in the queue. 4 o'clock, if you get referred to the doctor, 4 o'clock, the doctor's gone. Doctors leave at 4. So you have to come back tomorrow. And sometimes it can take up to 3 days.
Okay, ndihlala eChintsa apha into endiyenzayo ndithatha i-treatment ye-HIV ne. So into enzekayo ke ngoku kwala cala lakwa chronic into eyenzeke siye silibaziseke. Umzekelo incwadi zethu zilahleke ne. Then ke okayilahlekileyo incwadi kuye kuthatha ixesha loba uyifumane incwadi yakho. Umzekelo funeka uhlale 1.5 hour kukhangelwa le ncwadi yakho. So mna bendicinga uba ayikho enye indlela abanokwenza ngayo na uba kungalahleki incwadi because uyayenzela indlela abanokwenza ngayo babeke ngayo incwadi ba incwadi yakho ukhawuleze ukuyifumana ingalahleki ube udlulwe ngabanye abantu. then ke into bendizoyincoma kwela hlobo besifika ngalo sifola pha phandle besifola pha phandle then ke into enzeka kwabantu bebafola pha phandle abanye abantu baye bafumane baphakwa uyabopha phandle njengomakazi wam waye wasengxakini wawapha phandle xa kukho amaphara afuna ifowuni so ngoku ndivuyela kukho improvement yenzekileyo uba ngoku ngaphakathi ndiyancoma uba ngoku noko umohluko ngoku awusafani nakuqala alaa hlobo abantu bebegodola bemangalo phandle ngoku singeniswa ngaphakathi so ndiyayincoma le nto yenzekayo ngoku. Then ndiyafika apha ke umzekelo ngokwe-bus 8 okanye 2-9 umzekelo ndizawuphuma 3:30 kwicala lamayeza ndiphuma early xa singakhange silibaseke kwicala lencwadi incwadi yakho uyifumene msinyane uye uphume early like mna xa ndisuka yi-1 hour xa ndisuka eChintsa ndisiza kwe-1 hour ndiphinde ndizokhwela kwinkca because ndikhwela apha etawuni ndiphinde ndize apha inoba yi-1.5 hour ke ngoku. iChintsa ikliniki yethu eChintsa yi-mobile clinic ayifiki ngexesha sometimes ifika siphangele then thina ke ngoku siyasilekisha uzophela itreatment yakho ungakwazi iideyithi zakho uziposa because ayinandlela yoba efika ngayo sake sayikhalazela indaba yekliniki phaa kufika imoyiplan sisithi siyayibawela ikliniki yethu yapha eChintsa so ngoku kufika imobile which is abantu abaninzi baphela bethatha iitreatment zabo ngaphandle emalantuzeni elalini uyabo so ndakhetha ke mna iklisi ndikufuphi ne-East mna mntu ukwazi ucela emsebenzini uba ngedeyithi ethile ndibhalelwe ndizawukwazi ke nguzothatha but then bandivumela kwabo ikhonto.
Ndinengxaki ekliniki ikliniki endisebenzisayo ikliniki eGreenfield namhlanje ndibe naso isikhalazo kakhulu kubo inoba ndiye 4 times kubo ndibaxelele uba ndifike apha 7:30 xa ndiyobatshekisha incwadi yam bathi kum incwadi yam bayibeke rongo ngemisteyiki so ndisemva ndizawukwazi njani uba semva because apha ndiyotsalisa amagazi and anexesha ahamba ngalo so funeke ndilikhavarishile elaa xesha ingasheki. Okokuqala isibetha kakhulu into ongapho kweshelter because siyatshiswa lilanga kwaye xa kubanda siyagodola xa kunetha siyanetha phandle. Kwelinye icala namanesi ayashota for especially kweli lami icala.
Sihlala ngaphandle ko-5 sifolile pha kude kubethu 6 sihleli pha ngaphandle kuyanetha akunethi sizawuthatha ngo-7 sizikhalazo zam ezo sidwelele uli-7 sizawuthathwa 1 2 3 4 5 6 10 ne because ezitulweni kuhlala 3 since kwabakho i-COVID phaa kwelaa cala loncedwa ngamanesi emifufuzweni ezikalini bathatha ixesha elininzi usihoya bajikeleza nje apha phakathi kwethu singayazi uba asi-understand uba benza ntoni. Sometimes singena nomntu mhlawumbi umsemveni kwam laa mntu userious kakhulu naw kunyanzeleka uba simphi igap ngelaa xesha basawuqala ngalo andile besingeniswe ngo-7 ngoku siyoncedakala ngo-10 okanye nge-10:15 but sihlele ezitulweni sibanintsi ufumanisa uba phaa oogqirha baqala ngo-10 so xa ke ngoku ndisiya emayezini ndikhululwa ngugqirha umzekelo nge-3:45 basancedwa babebe phaa phambi kwam so ithi ke loo nto kude kuvalwe phaa emayezini ngoku ndihambe ke kuthiwa sizawubuya ngomse sisenzelwe inumbers kuyanyanzeleka ndiphinde ndispende imali ndiphinde yi-R40 ngelanga and ke ngoku njengoba iyi-R40 nje uba ngaba ndikhwele ndaya phaa ndohlika nge-R20 xa ndiphinda ndikhwela phaa ndikhwelele etawuni yi-R15 that means ke ngoku xa ndiphindaphindileyo ngemini imali endiyenzayo yi-55 because yi-R15 ngapha.
Sifike apha ngo-5 kodwa kumnyama and yabo basijonge nehlathi ngoku lehlathi elingapha ndise i-day hospital le sifika ekuseni yabo sidela iingubo sidela utsotsi nxa sifuna ufika early uba utyhwise ube seqaleni uyakona uthi sofikile ke ngoku apha emtholampilo siyabo aseyunit azivula apha ngaphakathi funeka ihlale ngaphandle sithi ke umthetho omisiweyo apha makungangenwa apha makungenwa xa kufike oonesi yabo bathi ifike yabo buyisende uba kufiwe phaa ngaphakathi abantu balwa ngaphakathi babulala okanye isigulane sifele ngaphakathi kungekho mntu ayo-24 hours ngokoyazi kwethu thina kuba noba be-24 hours befana isawo ivulile ngoku oko-24 hours ivalile le nto bavula 7 singene phaa sityhuwise phaa ngaphakathi phaa ngaphakathi sesilaa ndawo sikutyhuwishela kuyo aba bantu babhalisayo phaa bafike phaa bancokole isidala bangasuki behle benyuka kodwa 7 bethile funa beqale ngayo boqala ngoma-past 8 ayizonto zerayithi ke ezi kuhanjwe kubhekwe emfufuzweni basebenza ke ngoku ungena ngaphakathi emanesini ndihanda kancoma amazinesi wakhona lapha ayasebenza and ayamjonga umntana nomntu kodwa uqala befuna ugqoka and baba le nto bangayi-understandi baye bakuthathe bakusele ugqirha nakulaa ndawo kufola kuye emayezini asihlali phaa mna mntu beke waye uyakona but into ingxaki yethu apha ukuthi sesiphaa ngaphakathi le ndawo kuqalwa kuyibhalisa aba bantu babhalisa phaa behle benyuka bebe bencokola isidala uyabona ziyabhora ke zonto buza intombi yam uba le nto eyifolele uba sofufuzile ulosisi yena ubuzamfufuza ngokwakho na uyabona loo nto i-attitude esinjalo khange ndikhubeke ukuva khange ndikwazi noba ndongena noba ndithethe karhabaxa nalo mntu kaloku kukhona into kuthiwa si-GBV ngoku uyabo izawuba ngathi ngoku lo mntana ndimenzele into uyabona makuba ndizithobe ibe ngathi ungumama wam ngoku athethe kakubi kum.
NdinguSimavuyo ndihlala kwa-1 eMdantsane ndisebenzisa le kliniki inguNontyatyambo. Le kliniki inguNontyatyambo ngekuba okobe namhlanje ndivuke u7 ubethe ndilapha sabhalisa kakuhle safufuzwa kakuhle noogqirha basiphatha kakuhle into izoxinga emayezini oko bebencokola edispensary from u12 kukhona ndiphumayo ngoku uzawubetha u4 ayikwazi kwidispensary esinokhalazo ngakuyo besikhala sonke phaa idispensary qha abantu boyika uthetha boyika ubulawa sometimes siyakwazi ugoduka amayeza akho ungawafumenanga ngokuvukile kufuneka uphinde uthathe 2 days uza nganeno 40 rand kukhwela 40 rand ukhwela ibuhlungu jonga kanditye kokusile ndizawugoduka ngesisu esiphandle esilambileyo ndisenofika endlini umbane ungekho siphethe kabuhlungu kwaNontyatyambo dispensary baninzi bayancokola phaa. To me I always find my fight because I stole it and put it on my back. Otherwise all the patients are always starting their new files.
apha kule kliniki ingaske sifumana uncedo kwicala lamanesi ayashota kakhulu kwistaff sishota kakhulu because xa unengxaki sentsho awukwazi uba akwazi ungancedakala ngokhawuleza.
Okay, thank you. Can we now move to the community stories?
Ndiyazibulisela kwi-comrades akaTech. Igama lam ndingu-Unathi Tatu.
My name is Unathi Tatu.
Ndiyandibranch yasemaSakhane. I-challenge endakhe ndadibana nayo eJabavu Clinic. Ndandithatha i-treatment eCentral. So
I encountered a challenge at Jabavu Clinic. I used to take my treatment at Central.
So ke ndabethakala imali ye-transport for ndibane ndisiya kwi-check-up eCentral. That decide uba mandiye eJabavu.
So I didn't have the money to travel to Central, so I decided to go to Jabavu.
I-challenge endayifumanayo ke phaa i-attitude ye-staff. Kathiwa mandibuyele apha bendihamba khona. Ndathi mna ke lam i-Department of Health. Kakuthe umuntu makaye naphi na. What is another Department of Health inesi yayini-attenda ngaloo mini?
I met a nurse with an attitude there whilst I was trying to get help. And I told them that the Department of Health policies say that a person is free to access services at any clinic, and she told me to go bring the department itself.
Ndamke ke ndingayifumenanga i-treatment ngaloo mini ndabe ndifole ii-hours ngaphandle.
I
Kungene
left,
umuntu
I left the facility without receiving my treatment while waited for hours and hours outside.
ndabe ndihleli phaa phandle sifole phaa phandle kwangena umuntu kodwa wafika wahambisa incwadi waphuma ne-treatment yakhe engakhange afole.
And we waited outside while other people were getting inside and coming out, getting help and their treatment while we were waiting outside.
Attitude endayifumana ndaphela ndihlala ndidefaulta ke ngoku.
That's the attitude I got there, so I ended up not taking my treatment at all.
Okay, enkosi.
The next one.
Molweni.
Greetings.
Ngihlala eMdantsane ngisebenzisa iclinic uPhilani.
I live in Mdantsane. I use Pilani Clinic.
Nami ngizothetha nge-staff attitude.
I will also talk about staff attitude.
Okay. Mna ndantinamaqhakuva apha kwi-anus, ne? So ndafika ke kunesi ndamchazela uba kwenzeka ntoni. Wandibuza uba amaqhakuva aphume njani kwi-anus.
So I had pimples in my anus. I met a nurse and she asked, how did the pimples come out in my anus?
So ndamchazela uba okay, I'm gay, ne?
I told her that I'm gay.
Lamaqhakuva aphume after ndileli ne-boyfriend yam.
And the pimples came after I slept with my boyfriend.
Akhuza unesi sanibana.
She was so shocked.
Ba inyani nalento niyenzayo kuthiwa amadoda lana namanye amadoda, and I was like
asking if it's true that there are men that sleep with other men.
That ke mna ke andizokwazi uyiphendula lento leyo because mele uyayazi umdala into mele uyayenza kuvela unike into ezanceda apha kule nto ndinayo, then ke
I told her that
awungendawo kuyo.
I told her that I will not answer to that. She's old as she is, she's supposed to know these things. All she had to do was to assist me with what I came there to do.
But ke ndaphela ndifumana into enonceda, so i-attitude endayifumanayo mna leyo.
She ended up helping me, but I'm still complaining about her attitude towards me.
Molweni. Njengomama uNolwando ohlala eReston.
I'm Nolwando, I live in Reston.
Ndisebenza ikliniki yaseNontyatyanbo for i-treatment yam your chronic.
I use Nontyatyanbo Clinic for my chronic treatment.
Ingxaki ise-pharmacy kakhulu eNontyatyanbo.
I have a challenge with their pharmacy mostly at Nontyatyanbo.
Ngenye, I think it was last month. Babene lanto kababenayo phaya. So bathi ke kuthi sizawoywa. Bona baza kwenza le bayenzayo and then sizawoywa emayezeni. Then ndiyothatha treatment.
Last month I went there for my treatment and they had an event going on there and they told us that we should wait, we'll be helped, but they will first start with their event.
But bathi sizawuncedwa bona bazawuqhuba phaya then emayezeni sizawoywa. But safumanisa into yoba asihoywa emayezeni sihleli phandle sonke imini yonke oko sasifike kusasa ngo-7.
As they said that we were going to get help at the dispensary, but we ended up waiting there all day.
Kwade kwabetha u-1 and then ngo-1 saphakama ke ngokusonke saya phaa kulaa event yabo sabuza phaa kuba sincedwa nini na.
And the 1 hour came and we all decided to go to the event to ask them why they did not help us.
Weza ke usisi ke eniyazi uba uzande imqwapheli uba mhlawumbi intona kodwa ke ndiyabona uba unoba uphaa kweza ofisi zaphaya wathi hayi sizawoywa uzawuthetha nabo basihoye because bakhona balapha emayezeni.
Someone came out from the event and probably one of the people that are working at the clinic, she told us that we are going to get the help. She was going to talk to them.
Athi ke sancedwa ke sagoduka ke phaa ngo-4.
And they helped us after 1 and we ended up going home around 4.
Then ekuqalekeni kwale nyanga ndiphindile ndaya ndisiya kwi-check up.
In the beginning of this month, I went there again for my checkup.
Ndakhawuleza ndingena msinya ke kugqirha. Ndaphuma. Xa sifika emayezeni, sifika ngo-12 sekuvaliwe emayezeni bathi bavalile. Incwadi zininzi ngo-12 emini.
I got the service very early from the doctor, but when I reached the dispensary at 12, they told us they are closed because the clinic cards are too many for them.
So sema pha ifestireni ke bayivala ifestiri. Abazithatha incwadi zethu. Bathi masize kweli cala lingapha bakhupha kulo amayeza. Bazithatha ke bathi masibuye ngomso.
So-
Masishiye ii-files.
We went there, but they closed their window where we push in our cards, and they told us to come and bring our cards to come back tomorrow for the treatment.
So ke sashiya ke nyani incwadi zethu.
We ended up leaving our books there.
Kukho umakhulu ke ngumelwane wam. Naye usuka eRestin, naye usuka kugqirha. Naye zange bamhoye. Wathi omnye emcelela intoba at least ngumuntu omdala lo kunzima nohamba kulo makhulu. Zange bamnike naye amayeza engumuntu onjalo ongakwazi nokuhamba.
I have an elderly neighbor that was there on the day, and we ended up asking them if they could at least take her clinic card so that she can be helped because she's old and she can't even walk, but she didn't get any help.
Zange siwafumane amayeza sagoduka. Abuya ngengomso.
And we did not.
Afika kwa early ngo-8 safaka incwadi abakasebenzi. Benza lento kuncokola ke behle benyuka.
I came back.
Incwadi zininzi phofu ngaphakathi.
Came back the next morning. It was around 8, and still we did not get any help because they were there. They were just chatting with each other and not paying any attention to us.
Ayisahlala ke kuthe xa kubethu 11. Ngoku into enzekayo kubizwa aba bantu bafike namhlanje. Ndihambe ke ndiye efestireni ndizobuza uba kanti ithini into yethu thina abantu bayizolo.
So around 11, they called out for the people that were there on their appointment dates. And I stood up and went and asked, what about us, which did not get our medication yesterday?
Bothuke ke ba oni khona bekungona baya kula box bebefake kuyo ii-files zethu bazithathayo.
It's only then that they only paid attention and remembered that there were cards on the box left from yesterday.
So ke sendisho ba enontyatyambo abasikhathalelanga banankathalo ngathi emayezini.
So in all at Nonjajambo, they don't care about people, especially in the dispensary.
Simujonga uye kuthe uyothatha amayeza ubupha ngengomso ngezolo. Kodwa uzawuphinda umke ngofo ubufike kusasa.
Even if you were there yesterday, only coming today to collect your medication, but you still live around 4.
So ndicela ke noku department ke ilungise into yasenontyatyambo kakhulu kwela cala lasepharmacy.
Yes, we're sincerely asking the department to intervene in this regard.
Molweni.
Greetings.
Ndihlala eNU9 ndisebenzisa iklinik yaseLuyolo clinic.
I stay at NU9, I use Luyolo Clinic.
Ngo-August bendise umntwana wam oyintombazane firstborn yam ekhulelweyo.
In August, I went there to get services for my pregnant daughter.
So sifike ngo-8.
We arrived there at 8.
Sahlala kwabetho 1 ndangena kuba ndiyazi into kokubana umuntu okhulelweyo hoya uqala xa umbona into ingathi ungxamile.
We waited and waited, so I decided to get in and ask because I knew that a pregnant person is allowed to get help before anyone else.
I-attitude endiyifumeneyo kwinesi indishashalaze kakubi into kokubana nawusuka ndingene.
The nurse gave me so much attitude telling me that I can't just walk in.
Sahlala ke pha ngaphandle ndafowunela ubrother wam azothatha lo mntana because ndiyambona into kokubana uxakanisekile.
We stayed outside until I called my brother so that she can come and take my daughter.
Wabe esithi ke lo nesi kungolosihlanu namhlanje asihlalela loo nto asisebenzi thina.
And the nurse said it's Friday today, we are not working, they are not going to stand for that.
Sahamba ke no brother wam ndalayisha umntana sahamba. Umntana wabelekela endleleni.
When my brother came and took my daughter, we were leaving for another services in another facility, and my child ended up giving birth on the road.
Xa sifikayo eMakhiwane umntana usolekile.
When we arrived at Makiwane, we found that the child has already been stillborn.
Inkosi.
Thank you.
Molweni.
Greetings.
Ngizothuza ngoNontshatyambo.
I will talk about Nontshatyambo Clinic.
Ndabe ndise uthatha treatment yam.
I was there to collect my treatment.
So ndabe ndiphose date. So ndaya ke ngiyothatha treatment dadibana no sister. Ngixebana defaulter.
I missed my appointment. I missed my appointment date, and when I met the next day, she told me that I was defaulting.
ingabe namsebenzi ke ndidlule kuya ndihoye nje laa mzuzu xa ndifika emayezini naphayana ndiphinde ndizuse kuthiwe kukho into eshotayo ndiphinde ndibuye kugqirha back.
She ended up helping me, even though she shouted at me. But when I reached the dispensary, they told me that something was forgotten, so I have to go back.
Ndihambe ke ndibele kugqirha abhale amayeza but ndaphinde ndinika amayeza amashotayo bendifanele ndibhalelwe i-3 months ndinika amayeza ashotayo phaya bathi banganika u-1 month.
Even though the doctor wrote the prescription, but at the dispensary, they gave me short medication.
Ndakhetha uphuma ke ndozifunela ngapha ndabona indlela abaphatha ngayo abantu kakubi ndaphuma ndozifunela enye organization ezakwazi undiphathela i-treatment endlini.
So judging by their attitude, I decided to leave and go find other organizations that would help me get my medication. Thank you. Yes.
Thank you. So we will go to recommendations now. The other thing, Comrade Taluxolo, I forgot to mention. Kuba, I am also a board member. We Office of the Health Standards Compliance. We had a strategic planning meeting. There are doctors and professors there. And I'm the only one who is a community and who represents the people. One of the things that I said to them, and I'm saying it here now, that as the General Secretary of Treatment Action Campaign, I have been understanding that our government does not have enough money for purchase of other services. And as a result, we had to tone down. But us toning down, we are toning down on the expense of the people. I know that the huge chunk of the budget, health department, does not go to purchase healthcare services or goods. It goes to pay medical legal claims. And I'm asking myself, if the officials of the department do not pay attention to this, what are they expecting us to do? Because I'm tired of doing. But I am not tired of taking our government to court again in defense of the rights of the people, so that Abo Fikile Mbalula and others can go and insult us as civil society. I care less. But what I cannot accept is a situation if I neka comrade lower. Status sakhe without a consent yake being disclosed to the public, and nothing is happening about that. And we are expected as people living with HIV to go back to the same facilities again, where status sum was made known, and I'm expected to take it as well. I'm asking myself, when are the officials of the department, not only here in PCM, when are they going to take it upon their shoulders to sensitize the nurses, to make nurses to understand that we as the citizens, we've got the rights enshrined in Section 27 of the Constitution. We as the citizens of this country, we've got rights on Section 10 of our Constitution, which is called the Bill of Rights. They have signed some oath, and within that, they are told that patients have rights, but these rights of us are often trampled upon each and every day, and nobody is doing anything about that. And I'm asking myself, we will be wrong if we can go to a comrade like that one, to sue the nurse who disclosed the status act. Is that what the department wants us to do? Because if they don't do anything about these things, we will be left with no choice to identify all people who have these problems within our healthcare system and say, here are the lawyers, they are going to defend you. Are they going to say, we are civil society that is counter-revolutionary, which is paid by the Europeans to counter the governing party, or people will begin to own up on their mistakes of violating the rights of the people? I am not saying Ikeska Comrade Liana is different from others, but what else must we do in order for the officials of our government to understand that they are not doing us a favor? It's an obligation which is in the Constitution. And therefore, as the people, we must always demand, or they want us to toy and occupy their offices, because personally, I don't support people who are closing clinics. When we have problems, let's go and occupy district offices, provincial offices, where people take wrong decisions, works. Not denying people the rights. Is it the right language or right thing to do for us to toy against our own black government? Because the people that we're talking about here, the officials and whoever, even about HOD, or Miss Wagner and Mr. Kamlash and other people, these are black people. And we thought when we took up arms in 1994 and backwards to fight against the racist regime, we thought that we wanted to liberate a black person, without knowing that a black person will again oppress another black person. It is wrong, colleagues. We must talk to izazela zethu. Sizibuze ukuthi ingaba sifuna uThixo sisekela kanani na if thina sengcikiva abantu bakuthi because of positions esikuzo and affordability. The reason in South Africa, colleagues, kune protest of service delivery every day and night, kuchiswa izitrato, kuchiswa izikolo, is not because of the government. It is because of officials who are failing the government. Because it is the officials who must make sure that a political decision is implemented on the ground. And when they fail to implement that, people get angry and they take up arms and destroy the same infrastructure which is going to benefit us as the people. And then the question I'm asking, why are these officials paid if they are not doing their jobs? But we need to address this, colleagues. We need to address this, not only in PCM, but all over. People are saying here loudly that we know after 2 o'clock, if you go to the clinic, you won't get services. They are saying here, if you go Friday to a health establishment, you won't get any services. My expectation is for the district health manager of Buffalo City, sub-district managers, just to try this and pay surprise visits to our facilities in order for them to see ukuthi, is this happening or not? Because according to labor law, Basic Conditions of Employment Act, Section 23, tells you 22 to 23. It gives you a mandate as an employer. If a person is hired to do a job and they don't do a job without any explanation, a principle of no work, no pay must apply. Is the department doing that to the nurses who are not working on Fridays? Are they deducting those days? If not, it therefore means the officials who are in authority are failing both the people and the state. And those people are stealing the money of the taxpayers for being paid on Fridays for not doing anything. If I was a district manager, I was going to go to those clinics, deduct Fridays of the month from all of them until they can feel the pain we are feeling as the people. Here are the recommendations. The Eastern Cape Department of Health should produce an annual report on the number of healthcare workers per cadre employed in each district. Include the number of people and size of areas covered by these healthcare workers, year-on-year comparison from at least 2021. The vacancies and the cost of these posts to the government. Fill all vacancies in 2023-2024 financial year. PEPFAR should support in filling all vacancies at PEPFAR Operation Putuma support facilities in the short term. Provide additional staffing for all PEPFAR supported sites to extend opening hours from 5 a.m. to 7 p.m. on weekdays. Fund adequate numbers of adherence club facilitators to allow for the restart of adherence clubs. Match should immediately do an assessment at all PEPFAR Operation Putuma support sites with waiting time over 3 hours and develop a specific plan for each facility that will bring the waiting time below 2 hours. Support the facility to organize and maintain an organized filing system. Ensure files are not required for facility pickup points. People living with HIV go directly to the pickup point to collect their ART refill. Get more people living with HIV into external pickup points to reduce congestion in our health facilities. We will go now to the next item.
So now we go to art collection. The revised 2023 National Adherence Guidelines note that time constraints are a challenge to many people living with HIV. They go on to state that effort should be made to support people living with HIV with suppressed viral loads to receive extended ARV refill and or be enrolled in a repeat prescription collection strategy. Implementing this is vital to support improved long-term adherence. Positively, Ritshidze data reveals that 82% of people living with HIV interviewed reported getting 3 to 6 months at refill this year in Buffalo City. This is a major improvement compared to 65% getting a 3 to 6 months refill last year. And Buffalo City is the second best performing province on art refill across all districts monitored by the Ritshidze. For those using standard medicine dispensing, 50% said they have not yet been offered the option to use a pickup point. All stable people living with HIV should be afforded a range of repeat prescription collection strategy options as per the National Adherence Guidelines. Further, 40% of all people living with HIV interviewed said that they would like to collect ARVs closer to their home where possible. There need to be enough pickup points to decant people who into especially linked to peri-urban and rural clinics. A diversity of external pickup points providers is needed beyond private pharmacy towards legally only available in urban areas to service rural areas. Small CBOs and early childhood development centers should be considered. In terms of adherence clubs, these options have been developed since the onset of COVID-19. Most clubs have been suspended or reduced to being just a pickup points. We maintain that functional adherence clubs play an important role in supporting ongoing treatment literacy and peer support to help people living with HIV stay on treatment. Importantly, in order to be effective, repeat prescription collection strategies should make ARV collection quicker, easier, and more satisfactory to people living with HIV. Yet this is too often not happening. While only 2 facilities monitored said that the people using facilities pickup points must collect files, take vitals, see a clinician before getting their parcels. 61% of people living with HIV said that this is the case, adding to delay at the facility. While it should take less than 30 minutes to collect your parcel and go, 10% of people interviewed said it takes 2 an hour, or 13% said it takes between 1 or 2 hours. And 41% said it takes over 2 hours to collect the medication. Once enrolled, every effort should be made to keep people continually active. A assessment should take place at clinical consultations to understand if people living with HIV are satisfied using their pickup points or clubs. People living with HIV who are not satisfied or very satisfied are reported by 50% of people using facility pickup points. Should be offered a different option that better meets their needs. Then we'll go to the recorded communication.
Ukuba phayana ke uhamba kwiklinikhi yase-Central bendingabona into irongo nabo xa ndicinga kha bebona into irongo kum mhlawumbi ngathiwa andiyityi kakuhle treatment bagqibele bendikhupha ngo-April bandisa kwifasilithi ngaphandle. Ndiyile ke ngo-April ndafika ndayifumana ipaseli yam ndabuya ndabe ndizophinda nge-10 kaJulayi. Xa ndiphinda nge-10 kaJulayi ndifikela kulaa pharmacy bendiye kuyo ndifika bathi abasareceive bagqibela ngo-April. Kwanyanzelwa uba mandiphinde umva ndiphinde phaa ekliniki khaba ndisokolise xa bendifika ndifike ndabavezela iinto zam bandikhangelela bandinika. Bekufast phaya ngobana ubuthi nokuba ngabe ufike mhlawumbi ngo-1 ufike ufumana ipasela yakho uphuma uhambe. Ekliniki ukuba ngaba awuvukelelanga into yobana kuvulwe sele uphayana ubuphuma nango-1. Simisa phaa phandle sityhwishwa phaa phandle silinde ke side sike sibe siyangeniswa. Then inye into endibona uba bendizawuyilibala i-Central Clinic yenza kakuhle kwilaa nto yokubana xa endinike ideyithi mhlawumbi loo deyithi andinike yona andinike nexesha. Athi kweli xesha ndikunika yona nge-15 minutes awuzulinde uba ngu-9 o'clock ulinde 9 o'clock akupethele ulapha. By 8:30 yiba sowufikile apha ube eli nge-15 minutes mhlawumbi so that uzokwazi ungena ngaphakathi uncedwe. Ukuba ngaba ufike kade ixesha lakho bekubekele lona likwedlule nedeyithi bathi uphuma ngo-4 ngoba umisishe ideyithi lazi nexesha.
Ndihamba ekliniki eGomboho apha ekliniki eNdende. Istori sam si-1 xana ndiya ekliniki ikliniki lapha funeka uvuke ngo-4 so xa uvuka phaa ngo-4 ke ngoku uzomka ngo-12 awuyoba ufike iipilisi zakho zifika ziredi zilinde wena kodwa funeka uhlala neepeshenti ezigulayo. Bathi kukugcwala kwabantu amanesi ambala ngamaxesha amanesi abayi-2 okanye beyi-1 so abakwazi usebenzisa abantu abanintsi. If kaloku uyawalanti mhlawumbi uqomba ngowudinwa kwakho uhambe xa uphinda uya mhlawumbi kwenye iveki eba ndifika ngolozine nje ndikunyanzeleka into yokuba ke ngoku kuthiwa ideyithi yakho uyiphosile funeka uhlale unoba ubuvuke ngalaa 4 uzawumka ngo-4 waleyithi. Ndayiphosa ideyithi yam apha kuMeyi then ndaya kwiveki elandelayo ngolosi nje bandisiya ngolozine nje yanyanzelwa uba ndiphose ide mandiphinde ndihlale ke ndizawufumana enye ideyithi efresh. Uyahoya qha kaloku uzawuya xa kumke wonke laa mntu uphayo ba uphose ideyithi funeka ulinde ngayikhathazeka ukuba uvuke ngo-3 novuke ngofuna uzawulinda bewuphose ideyithi yakho.
Mna ke ndihamba eGombo A ekliniki. Ndivuka ekuseni ngo-4 ndisebenzisa uCCMDD. Kuloo CCMDD sivuka ngo-4 ngoku. Kudala besiqhela uvuka mhlawumbi ngo-8 phaya siyohoya ngo-12 o'clock. Uthi nesi azikho kodwa i-treatment yethu ikhona phaa ngaphakathi. Frank uba nge-24 ndiyakhona ngoku ka-August nge-24 ka-August i-treatment yam izawuba ikhona ngala 24. Ngena efowunini kum ithi ngomsombo othatha i-treatment yakho kodwa ngoku last year besingavuki ngo-4 o'clock busiya nge-to 8 nge-past 9 okanye 8 ufumane i-treatment yakho ithathe uphume. Ngoku funeka uhlale nabanye abantu abazothatha i-treatment. Etshintshileyo kuba kwamka in-charge yapha ekliniki kwaza omnye ke ngoku wathi ke ngolona sifola nabanye abantu bathi abantu banintsi kwaza kwathini neenesi zincinci zibambalwa okanye zibe mbini inesi inye zimbini njalo njalo bakwazi uqala past 8 nge-to 9.
Okay, I would now move to community stories.
Ndisebenzisa inontyatyambo.
I'm Bongiwa Makadla. I use Nontyatjambo Clinic.
Last month beyi-date yam bi-14th date.
Last month on the 14th, I had my appointment at the clinic.
Ndifike ngo-7.
I arrived there at 7.
Incwadi edispensary ndoyifaka ngo-11.
I got my clinic card at the dispensary by 11.
Kwazothiwa nge-3:30 iipilisi zam azikho azika-odwa.
At 3:30, they told me that my medication is not there. They have not ordered yet.
Mandize kwiveki elandelayo Monday.
I should come Monday the following week.
So ndathi andinazo yoba mandizitye ke ngoku kule weekend kuthe ndingezi Friday bathi ke basigqithisa iipilisi Friday.
I told them I don't have any treatment for this week. Why don't I come Friday? And they told me they are not dispensing any treatment on Friday.
Ndile Monday.
I went there Monday.
Ndifike ngo-8.
I arrived there at 8.
Iipilisi zam ndiyozifumana ngo-12 kusithiwa ayikafiki i-order yam.
But I received my treatment at 12. They told me that my order isn't arrived yet.
Enkosi.
Thank you. I stay in Dias at Reston. The mobile clinic arrived while I was in Tavern in Kumcha.
So treatment.
They tested me and they took me to get my treatment.
So ke ngoku ndayavisithela ngapha ndazohlala apha ku-boyfriend.
So I moved here with my boyfriend.
So ndacela ke ngoku apha ku-mobile clinic into yobana mandifumane iipilisi because andinazo sendiphelele.
So I asked from the mobile clinic people to give me my treatment because I was out of it already.
So yathi ke mobile clinic ayikwazi undinika i-treatment yam andiphindele apha bendivela ndiyothatha kula clinic yam ipilisi treatment.
So the people from the mobile clinic told me they cannot give me my treatment. I must go back to the clinic where I took my medication. I haven't taken my treatment even today.
Molweni. Mna ndihlala nomuntu o-HIV positive. And okay.
Would move to the recommendation on behalf of the GS. So the Department of Health should extend and implement ARV refill to 3 months by the end of December 2023 and 6 months by the end of September 2024. The Department of Health and MATCH should ensure that all people living with HIV are offered a range of pickup options, and those enrolled in pickup points or clubs are active. Ensure that reassessment of pickup points options take place at each clinical consultation to ensure people living with HIV remain satisfied with their pickup points or clubs. Ensure all facilities implement the 2023 Adherence Guidelines Standard Operation Procedure with fidelity, including ensuring facilities pickup points are a one-stop, very quick art collection only visit in under 30 minutes. No need to go to the registry, collect folders or see a clinician, and etc. Ensuring re-establishment or implementation of quality adherence clubs, including group facilitation components. Increasing the number and type of external pickup points to ensure urban, peri-urban and rural clinics have external pickup points. Ensuring people going back to the clinic for their pickup points receive the rescript on the same day, if clinically well, to ensure no unnecessary additional facility visit, with effective recall system to action any abnormal results or elevate viral load. Monitor and hold accountable PEPFAR district support partners to implement 2023 adherence guidelines standard operating procedures with fidelity. This needs to be done by PEPFAR. Would now move to art continuity. Okay, our next set group of issues are on art continuity. People living with HIV lead complicated lives and may well miss their appointments, even miss taking some pills. When they do, meeting them with support when they return to the clinic help ensure a long-term adherence. But often when people living with HIV and key population return to the clinic, they are treated badly, leading to people disengaging from care. A differentiated service approach is required for people living with HIV who re-engage in care. Some will require extensive clinical management, including advanced HIV screening and management. Some will require psychological support in the form of quality counseling and group support actions. The majority need it to be made easier to collect treatment. These people should be offered multi-month dispensing and should be assessed and offered access to pick-up points or adherence lab as quickly as possible. Implementing 2023 re-engagement and clinical adherence guidelines are vital to supporting improved long-term adherence and retention. Match should support the remaining 27% of facilities and all others in the district in training, mentoring on the changes in the new 2023 adherence SOP. Ritshidze data reveals that out of 619 respondents, 78% of people thought that the staff were always friendly and professional. This graph shows data across time since data collected began in the district. The district should continue to improve to ensure all people living with HIV, key population, and other public health care users are treated with dignity, respect, and compassion at all times. It is also important to note that because Ritshidze interviews take place at facility, people who have already disengaged from care due to poor staff attitude, some of who would hear from in our community stories, would not be in the facility, will not be at the facility to be interviewed. Out of 88 people living with HIV who had missed appointments, only 8% said that staff were welcoming when they came to collect their ARVs if they had previously missed a visit, and 60% said that staff counseled them on adherence. However, 20% said that staff still send them to the back of the queue the next time you come in. Yet, according to the National ART Guidelines and Differentiated Model of Care SOP, people should not be sent to the back of the queue or made to wait until the end of the day to be seen. A returning patient should take up the next queue space. The guidelines specifically state that no punitive actions are allowed. People should join the queue as normal on arrival at the facility, irrespective of whether on time or late for their appointments. Punitive action leads to people deciding not to come back again. We need to normalize late missed appointments without penalty. People who have come back despite being late or have made it easier for the health system, it is not necessary to track and trace them and encourage them back into care. The person has stepped back into the facility, so that experience should be as supportive as possible. While most people did not report transfer letters being a challenge, 217 people interviewed by Ritshidze had been denied access to services for not having a transfer letter across 9 facilities over the last year. While this represents just 9% of all public health care users interviewed in the district, given that most people interviewed are unlikely to have attempted to transfer services, it continues to point a much larger problem regarding the communication and policies regarding transfer letters. A reminder that transfer letters are not required in the guiding principle of the re-engagement SOP, which states, if a patient comes from a different facility, it is critical that the patient be provided with treatment on the day of presentation. While referral letters are helpful, a patient cannot be required to leave the facility without their treatment. 112 people interviewed by Ritshidze have been denied access to services for not having an identity document across 8 facilities over the last year, representing 5% of people interviewed. All sites should be urgently investigated. Again, it is important to note that Ritshidze interviews take place in the facility. Therefore, people who have already disengaged from care due to challenges accessing a transfer letter or not having an identity document will not be at the facility to interview. Psychological support is another critical element to ensure long-term retention. Positively, Ritshidze data shows that 99% of people living with HIV interviewed do know that psychosocial support is available. However, a full package of psychosocial support are not yet available at every facility. A full package of services should include a provision of individualized quality assured counseling to patient, peer-led patient navigators acting as a bridge between clinicians and patient, mapped networks of referral system, optional support groups, and food parcels. As part of psychosocial support groups should also be linked to each facility, public health facility, and that critical to provide counseling and support services to people prior to testing, post-testing, pre-treatment, and those struggling on treatment or re-engaging in care after a treatment interruption. Treatment literacy also improved our continuity as people understand the importance of starting and remaining on treatment effectively. Positively, Buffalo City performed extremely well on these indicators. Of the 313 people living with HIV surveyed, 100% had received a viral load test in the last year, and 100% reported that they knew their viral load. 100% agreed with the statement having an undetectable viral load means treatment is working well, and an additional 100% agreed with the statement having an undetectable viral load means a person cannot transmit HIV. We commend the district on their performance around treatment literacy. We would now move on to the recorded community stories.
Unokwaziwa nakubani na ba lo uzothatha treatment ye-ARVs kuba kuthiwa abazothatha ipilisi ye-ARVs mama benekwelicala. You understand, which means it's not that uba supposed to be duty yabo loo nto to disclose i-status zethu. Mna bendizawutshintsha ikliniki regardless to that sihlala apha elokishini siyazana. You understand? Akho nto uba ndithi xa ndiyofuna ii-services zam funeke ngoku siyohlulahlulwa apha ezitulweni, which means naxa mhlawumbi ndixabana nomntu apha elokishini uzawuvesa ii-status zam.
Ndingumntu treatment phayana ye-HIV. So ndandisuka eJoburg last year. So ndingazange i-transfer letter. Mandihambe yocela ndiyocela khona baxela uba andina treatment endiyityayo apha kuba ndingenayo i-transfer letter. So ekliniki bandisokolisa bafuna i-transfer letter. So ndithi mna kandilapha andikwazi ubuyela phi back eJoburg. Andibabuza ikliniki ebendihambayo bendihamba phayana eJoburg. So ndibaxelele bathi ifowuni yaphayana ibanjwa. Into enjalo. So ndahlala last year wonke ndingatyi treatment. Ngabantu besilato of hope kuba hamba bengena door to door bebuza uba utye ntantoni na ndaxa nditya treatment HIV kuba kudala ndiyitya. Into enjalo kumhlawumbi kwinto ziyenzeka phambi kwam uba ndingathatha i-treatment. Abantu abadefolthileyo beberongo abanye abade basweleke.
ikliniki esiyisebenzisayo apha eNew Life yi-mobile clinic. So i-mobile ifika kuthi ngoLwezine. Khange ifike ke for inyanga, I think inyanga ene-2 weeks ngoku. Asizifumani, ziphelile ngoku ndithethayo, besiyile ngoLwesine khange ifike. And then siyahlala kungabikho nto isichazelayo ukuthi siyahlala ixesha elide like sivuka ngo-8 and then siyakwazi uhamba phaa ngo-11 ngokucinga uba mhlawumbi senofika ngo-11. Kuye kwafika umntana eze nomyalezo uba kuthiwa iklinikhi ayizubakho. Utsho bani? Hayi kuthiwe uyaleziwe ngumntu ongusisi uba iklinikhi ayizi. Ikhona iklinikhi Nontyatyambo esemdantsane. Proof of address ekuza kubonisa ukuthi uhlala phi. Bathi ke eNontyatyambo kasuyileyo bona sibenzela umsebenzi omninzi. Bathi inani basebenza inani elingaphezulu komlinganiselo. That's why bengakwazi ubagqiba abantu.
Ndiyocela i-treatment kwikliniki Central Clinic. I-treatment ezi-ARVs, i-TLD. So bandinikile kabini babuza into edibene netransfer, uba itransfer ndizawuza nayo nini. Ndathi ngelo xesha andikabikho sure ngoba ndizawuyifumana nini kuba ndingekabi nayo indlela yogoduka. Ndaphuma ndahamba ndaphinde ndabuya okwesithathu. Okwesithathu ke ngoku ndifike ndabhalelwa kwikhadi lekliniki kodwa ndingaphinde ndibuyele apha ekliniki ndingayiphathanga ndingayiphathanga i-transfer. Kwenzekile ke ndayitya i-treatment le bebendinike yona yaphela. Ndaphinda futhi. Xa ndiphinda besengu-4 times. Xa ndifika phayana ndafikela kusister ke owandincedidayo loo mini but endinceda ngomlomo engandiniki i-treatment. Wathi mandibuye ngengomso. Khona ke new sister endandihambisana naye eyondincedisa kule nto yobana mabaphinde bandinike noxa itransfer ingakafiki. Akaphendulwa kakuhle ile nesi, nam ayandiphendula kakuhle. Yathi kwakungoLwesine loo mini, yathi yona mandibuye ngoLwesihlanu. Namhlanje yona ihoye abantu be-appointment. Sathi sesicinga uba siyahamba ndaphinde ndathi no andizuhamba apha ndifuneke andiphe for noba ngamala nto kayi-3 oko 3 days enziwa ndizokwazi ubuyela kuye ngoMvulo. Sisi owayendinceda onesi apha akazange andiphendule kakuhle, wandishawutisa nje ndagqibela sendikhwaza ke ngonam sendinqola ndiviwa ngumntu okhoyo kulaa kliniki uba ndizokwenza ntoni. Ndazama ukuba itransfer mayifumaneke ndilapha eMonti. Yafumaneka nyhani itransfer ndilapha ndaziyela ndayisa ndayinikwa i-treatment yam. Then ke kuba abantu belaa department ndingabazi bonke, khona omnye utata waye wandincedisa kakhulu nomnye usisi ndizothi ngusisi uba wayethetha efowunini zange ndimbone. Naye wandincedisa kakhulu ngoba wandifowunela ekuseni wabe sithi into yam ilungisiwe mandiyiye mna ekliniki ndiyothatha ezi pilisi. Nyhani ngo-7 ndabe sendiphaa. Ndafika iqueue sele inde ndama engasemva equeueni, kwaphuma lo nesi bendiyigezelela mini ndandifike ngayo. Kwaphuma yena wazondijongela endlini wandifumana. Wabe esithi ubizelwe imithingi, uleqa loo mithingi kodwa bengazukwazi ukuhamba engandinikanga le treatment.
Ukuqala kwam sekusisikhathi sekuzinyanga ezipheleyo ndiyozama uyothatha i-treatment yam because bendingumntu othi i-treatment ngosumomo wam. Qha bendikayithatha bendiyatha phaa komedlalini enqamakho. Xa okanye ufika apha bandifuna into edibene netransfer ndabanika ke adress sasenqama kwephathi waxa bathi no abayiboni ndithi no hayi masikhona ngasifumana injani no sikhona nje ikliniki ndithetha ngayo wazathi omnye ngazama uyikhangela isikhathi eside ndamane ndisiyintsuku ndamane ndisiyintsuku wathi hayi abayifumani ikliniki koyicebo ndenze njani ngoku because ndiyabawela mntu uba ndiyitye itreatment kaloku akukho nto ndiyifumanayo ebalulekileyo ndimase ndiqalele ke ndithe nditheste okutsha ke ndisenindike okutsha wandiphela wathi izawuba nzima ngolo hlobo olo nto andayekelela phaya mna into edibene ndibona into edibene neklinika phaya ngoku iyandisokolisa kuba ko ndizovelwa yilena ke ngoku into sendiyencama into edibene netreatment oba ndingayitya kwecala sendifanele izigodusa uba ingase sendigoduke uba ndiyozitya itreatment yam because umsebenzi waside ndifike wabe sowuphelile wona akukhabo sesifumana khona into zifanele ndiglisa mandithi ngokuhambe ndisidibana nazo esitratweni like into ezifana namakhondom so sidibana nazo esitratweni sizichole ezo mhlawumbi ziphethe loo box ibikulahlwe nguloo mntu aziko bekutheni na but uba uthi uye ekliniki ufuna into ezifana nezo zinqabile ezo chances.
Igama lam ndinguphelisa Ntyintyi ndine-35 years ndihamba ekliniki enontyatyambo ndithatha itreatment so phaya ndiyakwazi ndifike phaa 6:30 kusasa sihoywe ngo-10 kube kuseza kuthiwa ngo-12 izawuba yi-low shedding so sihlale phaa imini yonke kude kubethe u-3 so kwafuneka singenise incwadi ke ngoku kweli cala lasedispensary kuthiwe masibuye ngomso ndiyakhwela ke kanti yaphayana ndiphangeli ndingumntu wegranti ndibuye ndinazo iipilisi nangoku ndiyekile itreatment yam ngenxa yaloo nto thatha ugqibela ngomthatha itreatment bengoFebruwari ndabuya leyithi oko ndandilindile ndabuya ndingayifumenanga itreatment imali kuba ndibanayo kade so ndavela ndaxoma ndisane ndihlala ke ngoku ndathi xa ndisiya ke ngoku phantsi uba uyashawutwa uba ungakhange uye ngelaa xesha ushawute uba ideyithi yakho idlulile ntontoni uhlale ke usilinde.
Okay, mna ndihlala nomuntu ophila ne-HIV.
I stay with a person living with HIV.
Uqala kwethu treatment beyithatha e-Free Hospital but because of i-COVID wa-default.
When he started taking a treatment at Free Hospital, but because of COVID, he defaulted.
And then ba recommend i-community clinic esinoya kuyo and then sa decide ba sizoya e-Cambridge West.
So they recommended a community clinic that we can use, and we chose Cambridge West.
Saya e-Cambridge West and then okokuqala sa attendwa inoba sithathe i-treatment pa 2 to 3 times maybe.
We got to Cambridge West and we were attended. I think we took the treatment there 2 to 3 times.
And then umuntu waphuma nomsebenzi ke ngoku and then mna ndaya engekho ndiyomthathela i-treatment since indimobhalwe pha.
Oh, and the person had to go out due to work. I went there to collect the treatment on his behalf.
And ngela date ndandisiya ngayo wayeseyiphosile idate yakhe.
And by the time I was going there, the appointment date was already passed.
Kodwa mandize naye xa ndizayo wabuya ndaya nayo.
So I was told I should come back with him, and when he came back, I went there with him.
Okay. Ongena kwethu sancedwa ngubhuti owayene-threads omhlophe omfutshane oyi in charge of i-clinic leya.
When we got in, we met a man who was assisting us.
Then uqale ngoshawutisela into yoba udefaultile. So xa defaultile abe wayedefaultile kuqala uthi makuthini so ufuna ungcwatywa na.
He shouted and shouted, telling him that he defaulted and asking why he defaulted. Does he really wish for him to die?
And sabe sasi-explainile uba ungumuntu ophuma nomsebenzi so sasike sayicela i-treatment ye mhlawumbe sinikwe le izaba ye-3 eenyanga ezintathu okanye ezi-6 but wathi akakwazi uyenza loo nto leyo because bacela i-letter that is coming from the landlord funeka uze ne-address yakhona esuka kwi-landlord uba you are renting or ungumntu ohlalayo phaya kulaa area because abathathi nabani na ungahlali phaa.
We explained to him that the person usually goes out to work outside of town, And he shouted and asked us to bring a proof of residence because they do not just take anyone who comes there. They need their proof of residence to give them 3 to 6 months refill.
Then wasishawuta lo bhuti akakwazi usinceda wathi uyayazi bafuneka uphinde watsalwe igazi so that he will check your viral load uba ikangakanani na.
He shouted and shouted, telling us that he needs to draw blood again and check how much the viral load in his body.
And abanayo umuntu ngala mzuzu phaya ozakwenza loo nto leyo.
And they do not have a person at that moment to do that.
Kuba ndandiyazi uzophinda ahambe nomsebenzi so sahamba I suggested into yoba masihambe so yenze birth care into ezawungxama ezokwazi uba aphinda amke ne-treatment kahambayo.
Since I knew that he was going to go out again on business, I suggested that we go to birth care for the viral load test so that he can have a treatment while he's away.
Xa zibuya i-result ndazisa wabe sengekho yena.
So when the result came, I went back to the clinic to show the man.
Yo, laa bhuti wandishawuta into kuqala sendivulele phofu incwadi le ibanjwe for into yoba ezandinceda.
So when he was looking at the card, he was shouting at me also.
Then wacheka i-viral load wathi yambona lo mntu sithetha ngaye ngumntu uzothathelwa umntu onothi geqe nanini na uyayibona le viral load ba ikangakanani na.
Looking at the results, he was shouting that I was there to pick up treatment for someone who's ready to die at any time.
Ndam-explainela uba uyakhumbula uba besilapha wakwazi usinceda still.
I told him that we were there earlier and he didn't offer any help to us.
Yayingathi ndimphushe ekonsini wandithuka laa bhuti wandithuka akakwazi undinceda tu.
He got worse and he shouted at me, swearing also, and he did not help me.
And then ndabuza ke uba sizawukwenza njani wathi akazonceda umuntu mna anothi yena uyaqonda uba bangapha abantu izawuba ngowesithathu umuntu ozamngcwaba osweleke engakhange amnike ipili. Yho umuntu osweleke naye elantukile ephosene needate zakhe kakule Cambridge.
He shouted and shouted and saying that he cannot help me because this would be the third person that dies without taking their medication on his care.
Then ndabuza uba bhuti uzawukwazi undinceda nangale nto yezipilisi because funeka ndizithumele ezi pilisi namhlanje.
I asked if he was going to be able to help me because I wanted to send the pills on that day.
Wathi andizokunceda sisi wathatha ithephu yakhe wabukela iividios apha phambi kwam wandiyeka apha phambi kwam wandiyeka wabukela ifowuni yakhe.
He told me that he's not going to help me. Instead, he was fiddling with his phone in front of me.
Okay, that day ndabaleka ndathatha eza blood samples lamaphepha ne-result ndaya kugqirha oyi-private.
So on that day, I took the results and went to a private doctor.
Uqala ngaloo day I think ndinazo i-proof up.
There's no need, darling.
Okay. So uqala ngala day thina saqala uyithenga i-treatment ye-HIV.
So since that day, we decided to just go and buy the treatment for HIV.
Because ndaya kugqirha and then waxela uba uzambuyisela back kule beyitya kuqala. And then sibone uba izawusebenza for 1 month na. And then amtshintshe if I pick up emzimbeni wakhe.
And then the doctor said that he's going to return the person to the medication he wants taken and see if it's going to work for 1 month. But if it's not working, they're going to change it.
So yaba njalo ke story sethu so uze sifumane thina i-treatment free apha eSouth Africa thina sayibhatala.
So that as my challenge, now we don't get any free treatment for HIV, we pay for it.
Inkosi.
Molweni, ndingumama uLucy Tatu. Apha ndaye ndaphulukana ne-treatment yam every ngokushawuta ngusister ngophosa i-date yam wathi akusofumana treatment apha hamba iyapha uhlala khona udifoltile kwathini
So some time ago, I lost a chance of getting my treatment because I missed my appointment date and the nurse was shouting at me, telling me to go back where I come from.
ndikhwaza ke ndishawuta ndathi xa ndizamphendula qonda yama ndingamphenduli ndabuya ndagoduka.
She was shouting and shouting and I didn't want to respond to her, so I decided to go home.
Ndacela ke umuntu ululeka ndathi make siphindele sibuyele efre ngoba kaloku andinawo amayeza.
So I asked from someone to accompany me to go back to Fresh so that I can get treatment.
Saya wandibona ndisangena ke wenza loo ntshawuto yakhe ndaqoma uba ibingabantwana aba athetha ngehlobo kubo mhlawumbe bezamphendula. Sahamba wathi masibheke empilweni.
So when I got there, she immediately spotted me and started shouting again and telling me that I should go back to Empilweni.
apho empilweni uthi masiye socela i-transfer khona ndithi ke make phaa kuye
She went. She said at Empilweni I must go and ask for a transfer letter.
ndizayicela njani empilweni kodwa bendisitya i-treatment apha and ezi treatment zityazo zimbini.
So I asked her about how do I go and ask for a transfer letter when I use Frey Clinic for my treatment, and I use 2 treatments.
Andifuna ukuthetha isidala sathi ke ngokuqonda uba yeyi uyashawutisa masihambe nangoko zange ndiyeke washawutisa sahamba ke.
So she kept on shouting and shouting, and we ended up leaving even then.
Empilweni kodwa nguye lurongo befamasi enzelwe nguye enkosi.
So we went to Empilweni and they told me that she was wrong. She was supposed to give me my medication. Thank you.
Molweni. Mina bendithatha i-treatment yam eMdantsane eLuxolweni Clinic.
I used to take my treatment at Mdantsane at Luxolweni Clinic.
Ndadicide ubuya ke ndiyohlala Kosi.
I decided to come and stay Kosi.
I-date yam yabe ingoMeyi.
I had an appointment in May.
Ndaya ke ngoku eGomposi Jabavu Clinic.
I went to Gomposi Jabavu Clinic.
Ndayocela iipilisi phaya. Bandiphendula bathi andizukwazi uzifumana iipilisi ezikhoyo phaa zonele abantu baphayana. Mandijike ndiyothatha i-transfer.
They responded saying that I cannot get any treatment there because the treatment that was there is only for the people around that area.
Xa ndiphuma ndabizwa ngusisi osebenza kwaphaa kwelaa cala le-TB ngaphandle.
So when I got out, one sister from the TB section called me.
Wandibuza uba ndihambe njani ndamxelela uba bathi abazukwazi undinika. So wathi ke ukucela ndizulise 5 minutes uzandibela iipilisi.
She wanted to ask if I got any help, so I told her that I didn't get any response. So she said I should wait for 5 minutes. She's going to help me.
Ndadibana nabantu bakwaTech besenza u-door-to-door Kosi.
So I met tech people doing door-to-door at sea.
Ndabaxelela isitori sam uba sithini na.
I told them my story about not getting any treatment.
Wanilungiselela usisi Eiko, wanezela i-transfer yaphuma kwangalaa mini.
So they indeed managed to help me, and I got at the transfer and I got my medication on the day.
Ndaya ngengomso ekliniki ku-Friday ndayocela iipilisi ndadibana notshaji waphayana.
So I went there the next morning. It was Friday, and I met the nurse in charge of the facility.
Wathi andizukwazi uzifumana iipilisi itransfer yona bayibonile ifikile but iipilisi andizukwazi uzifumana bazikhuphe Friday.
So she told me that they received my transfer letter, but they cannot assist me with my medication because they are not dispensing on Friday.
Ndabuyela kusisi Eiko ndaya naye phaa ekliniki.
So I went back to Sis Eiko. She accompanied me to the clinic.
Bathetha nabo ke ndaphela ndizifumana ke iipilisi baphele bendinceda bendenza nezinye izinto.
So after talking to them, I ended up getting the help that I need and also other services as well.
Molweni ndiyabulisa beningumhambi waseJabavu.
I used to use a Jabavu clinic.
Ndaye ndamuva ndiyohlala eMdantsane.
I moved to Mdantsane.
After ndimuvile ndacela itransfer.
After I moved, I requested for a transfer.
Transfer yam ndabuza uba ndizawuhlala phi ndaxa ndihlala kwa-2 ekhaya.
So they asked where would I be staying, and I said I was going to stay at 2.
Ndaya eNontyatyambo ndangumhambi waseNontyatyambo.
So I was going to Nontyambo.
Eyona nto yandoyisayo eNontyatyambo uyahoywa ngonesi ube rayithi. Nantsi into esemayezeni iyakwazi ukuphela iveki ungafumenanga iipilisi. So mna
One thing about Nontyambo, you get great services from the nurses, but you encounter challenges when you go to the dispensary.
Ndaye ndadicida uhlala phantsi.
So I decided to quit going to Nontyambo because you stay for too long not receiving your medication.
Wafowunelwa sister wam kodwa ndifoltile wandishawuta but usawuteni kwakhe wandithumela eSentra but ndirayithi eSentra.
They ended up calling my sister, telling her that I was defaulting aside for too long.
Yes, recommendations.
Yeah. You are not wrong to cry, my sister. You are not wrong to cry. Now I had to go out and cry outside. Because to some of us, these stories are just like a joke. And to some of us, we do not understand how we feel by being failed by your own government. At times, colleagues, I think Noloyiso Akona and the Ritshidze team, you need to go back to the district manager and say thank you for improvement on all the areas that have been listed here, because ours is not about finding faults, but we want to see equality of services improving each and every day. But as I'm sitting here, I'm asking myself, what else must we do? Must we convene a Truth and Reconciliation Commission between the users of healthcare services and the providers in order for a consequence management to be able to follow after that? Because there are many stories that are being reported here, and nothing is going to happen about that. And some of these officials, in our facilities and in government in general, when they are in these offices, you will think that they have made it in life on our expense. I do not understand, Comrade Thando Xolo, ukuthi whether some of these nurses or people who takes decisions within the department, they are coming from another planet or we're coming from the same planet. For God's sake, in all informal settlements, there are no addresses, street names. For God's sake, we know that we've got the highest rate of unemployment, more especially amongst young people. And as the result of that, people move province to province, area to area. And you are expected to travel all the way from Utenake to Limpopo just to get a piece of paper. Yet when we meet with the officials, they will say, all people who are on treatment are registered under tier.net. Where is this tier.net when I go to a clinic, I don't have a proof of address, I don't have an ID, I don't have this? Where is that tier.net? So it therefore means at some point our government has employed people who are lazy to think. People who do not understand the living conditions of a black child. That at times, because we do not want to be criminals, we don't want to rob people, and we have to move away from our homes to look for greener pastures somewhere. Whilst you are there, your treatment gets finished. And you are forced to go back. Yet, when Nelson Mandela was campaigning, one of the themes, better lives, better life for all. Who's this for all? If the majority of the voters are being denied health services. Tomorrow, when people are saying we have defaulted on treatment and we are going to default in voting for anybody, we will be accused. Because when we go and vote, we do not go and vote because we love Mandela or we love Zuma. We enter into a contract with our government that we're going to vote you into power, and in return, you're going to improve services to us. But when we do not get services, what do you expect us to do? You expect us to organize, mobilize people, go and ban and loot? No, we are not going to do that. But some of the officials are making the people of South Africa angrier than what the apartheid government did to us. And they forget that we are the ones who made sure that we changed the regime. Even these political, Abofikile Mbalula, let me not beat about the bush. Abofikile Mbalula, he was saying civil society organizations, and the other guy from EFF, from Mgcini, accusing civil society for fighting against the government, to say these NGOs and civil society are counter-revolutionaries. We are expected to smile. And they forget that as much as we are part of civil society, We are freedom fighters. I'm not going to talk about other people. I'm going to talk about myself. I carried AK-47 to liberate this country. The fact that I am in civil society is because I am tired of betraying my own blood and flesh. I decided to be on this side so that I serve the interest of the people. But, colleagues, something must be done. Officials, something must be done. I so wish Noloyiso and Akona, when you go to the district manager of BCM, Competent Kolo, is a very good and progressive person. You need to invite the district manager to Enonjajamb and ask him to disguise. So that ahlale phana to witness what we are going through. And I will be glad if the district manager can dismiss those people on the spot. If it means that we must go and raise money for lawyers to protect him, for defending the rights of the people, let it be. We cannot continue to beat about the bush on the expense of the lives of the people. We are made, Comrade Kolo, to default by the system and those who are behind the system because they are lazy to think, they are lazy to serve the people. Yet in all these clinics, in all these offices of government, there is a big poster there which is written by Topile. They wasted monies of the state to write that thing because they don't comply and adhere to that. And when we raise our voices, when we take it to the streets, when we break the law, they will say, you are attention seekers. You like to be angry. But must we smile when you see people crying, sharing their stories? And even after that, there is no follow-up which is going to be made as part of consequence management to sensitize the nurses. In Nelson Mandela Metro, NU11 last year, a clinic was closed because a nurse insulted a patient inside the clinic without a nurse knowing that this person stays just opposite the street. The guy went home to take up a firearm and chase the nurse. The blame was apportioned to the guy. Nobody cared whether the nurse was rude to the patient or not. Everybody said that the guy was wrong, but nobody cared to understand. Not long ago, here in July this year, in Nelson Mandela Metro, about 6 clinics were closed. Rosedale Clinic, Kapa Clinic, Max Madlingozi, because there was robbing and other things. And then we were told that, no, the facility was closed and people were not told where to go and get their treatment. And then we asked, what happened when the clinic was closed? They said nurses were receiving psychosocial support because they were traumatized. And the question I asked, what did you do about the patients? Because if gangsters entered into a clinic and robbed a nurse, then whatever other nurses saw is what the patient saw. There was nothing done for the people. If really this is the government of the people, by the people, for the people, that must not be a rhetoric. We want to see it happening on the ground because as it stands now, I'm sure even you, on behalf of the PEPFA family, you can see, Guti, the reason people are disengaging, it is because of the system that is rotten. And I'm asking you, not now, but in another platform, why do you continue as PEPFA to fund district support partners? Why are you funding them? If the same district support partners are not going to come and speak a different language which protects the rights of the people. As I'm sitting here, I do not know across the country how many people as Ritshidze and Treatment Action Campaign, including PLHIV sector, we went to their homes and returned them back to care because they have defaulted. And I'm asking myself, must we bill PEPFA or must we bill those DSPs for doing their jobs? Because we cannot have DSPs, district support partners, working in our facilities and they continue to perpetuate the violation of human rights. They must be able to stand up, irrespective of their friendship that they have established in those facilities, but their duty is not to be an extension of the department. They are given money to improve the quality of HIV and TB services. But when they begin now to be 10 coats and try to be like government officials, we're going to have a problem. We expect DSPs to be on the side of the people and on the side of justice and truth. When people are being violated, you were supposed to be the ones to know as PEFA to say, some of the facilities that are adopted by PEFA on Fridays, they don't provide services to the people. You must ask your DSPs, why are they not reporting about this? Because you gave them money to improve the quality of services. And if on Fridays, services are not provided to the people, what are they doing about that? Going to the recommendations, the Department of Health should ensure all DOH staff acknowledge that it is normal to miss appointments and or have treatment interruptions. People living with HIV returning to care after a late or missed scheduled visit, silent transfer from another facility or treatment interruption should be welcomed. Ensure the Department of Health staff treat people in a dignified and friendly manner and investigate any reports of poor attitudes raised by Ritshidze and take disciplinary actions where appropriate. Send communication to all sites highlighting that no person living with HIV should be sent to the back of the queue if they are late for or miss an appointment as per national ART guidelines where no punitive actions should be taken. Ensure transfer letters are not be required for ARV continuation or restart. Any reports where treatment is delayed by a requirement of a transfer letter should be urgently investigated and disciplinary action taken where appropriate. Next slide. The Department of Health and Match should implement the 2023 Adherence Guideline Standard Operating Procedure with fidelity, including ensuring every person starting ART is provided with good quality, fast-track initiation counseling session 1 at ART start and session 2 after 1 month on ART. Taking first viral load as early as possible to ensure providing earlier adherence, intervention support, and earlier access to longer treatment supply at more convenient locations. Actioning an elevated viral load without delay, including funding and setting up effective abnormal results call system and providing quality enhanced adherence counseling when appropriate. Actioning a suppressed viral load without delay, focusing on immediate assessment, offer and enrollment into the repeat prescription collection strategy of choice the month after a viral load taken. All facilities must implement 2023 re-engagement algorithm, including differentiated service for returning of people living with HIV. Match should ensure that staff acknowledges that it is normal to miss appointment and or have treatment interruption. Ensure match staff treat people in a dignified and friendly manner and investigate any reports of poor attitudes raised by Ritshidze and take disciplinary action where appropriate. Support with training and mentoring of DOH staff at facility level on the revised 2023 re-engagement clinical and adherence guidelines standard operating procedures. Over to you, Belinda. We're going to key populations.
The next group of issues are affecting key population. Most key population are using public health facilities to access health services. So it is important that our clinics and CHCs provide a friendly, respectful, safe, and confidential environment. Yet despite sensitization, training, and retraining efforts, disrespect and poor treatment to key populations remain a common challenge. Ritshidze data reveal that public health facilities, only 40% of gay, bisexual, and other men who have sex with other men, 24% of people who use drugs, 7% of sex workers, and 47% of trans people reported staff are always friendly and professional. Where the attitude of the clinic staff have become unbearable, some people have stopped going altogether to the facility. Clinical staff were again this year the most commonly reported as being unfriendly and unprofessional by all key population, followed by lay staff. The majority of key population interviewed did not feel safe or comfortable at the facility. In order for key population to access health services and particular key population specific services, spaces are needed that feel safe, comfortable, and private enough to disclose you are a member of a key population group without fear of judgment, abuse, harassment, or even arrest. Disgraceful privacy violations continue to occur that destroy people's right to privacy. 42% of gay, bisexual men sleeping with other men, 58% of people who use drugs, 60% of sex workers, and 40% of trans people interviewed did not think privacy is well respected at clinics in Buffalo City. Shockingly, many people reported being refused access to services in the last year because of being someone who uses drugs, is a sex worker, or is part of the LGBT community, including 2% of gay, bisexual men sleeping with other men, 5% of people who use drugs, 80% of sex workers, and 30% of trans people we interviewed. This is unconstitutional and absolutely unacceptable. Where people do continue to suffer daily indignities of using a public health system, specific services remain unavailable. Ritshidze data reveals that few sites provide key population services, and when asked what are those specific services are, it becomes clear there is little available. Key population can't always access basic prevention tools like condoms, especially lubricants. External condoms were only available in 73% of sites monitored, and lubricants were only available in only 36%. Additionally, lubricants need to be put in places that people can take them without being judged, embarrassed, or even outed as a key population. However, most sites' lubricants were only available in main waiting areas or by the reception or by the request in the consultation room. When we speak to key populations themselves, 48% of gay, bisexual men sleeping with other men were interviewed. 38% of people who use drugs, 0% of sex workers, and 95% of trans people using public health facilities said they could not access lubricant. Not all facilities prioritize offering key population PrEP, despite it being available in 100 facilities monitored by Ritshidze. While covering a wider differing set of sites, only 57% of gay, bisexual men sleeping with other men, 28% of people who use drugs, 40% of sex workers, and 28% of trans people interviewed reported being offered PrEP at the facility, pointing to the reality that PrEP is sitting in facilities key populations are not always made aware of and actually offered PrEP. Key population are at times refused access to contraceptives, especially because of their member of key population group. As reported by 53% of people who use drugs, 9% of sex workers, and 67% of trans people we interviewed. Harm reduction services remain out of reach for people who use drugs. 0% of people had been given information where to get methadone, and only 3% able to access drug-dependent support. Gender-affirming services are critical, yet only 55% of trans people say facility staff are always respectful of their gender identity. 65% said healthcare providers use their wrong names, and 88% said they use their wrong pronouns. 81% of trans people we spoke to wanted to access to hormone therapy at the public health facilities, and most clinics were unable to even provide information to trans people about where to find them. Now we move to recorded stories.
Ndingathi bendingumuntu ebesebenzisa till ndabona uba ndiphantse ndasweleka bendisebenzisa something bekuthiwa yi-globe ndatraya cocaine ndapha ndisiwa empilweni I think kuthiwa iseGombo, yes. After ndifike phana andizuyazi noba lihlobo abaphangela ngalo but ke mna zange ndiyithande iservice yabo. Ndafika ke kuyiloo nto phana and ke ndasixelela isitori sam ke nabantu ke ndandihamba nabo bazama undincedisa cause ndandi-hyper. Xa ndiqala uxela yatsho ke enyekazini hamba nditshayile yabe isixela ke nto ndisitshayileyo. Kulapho ke bashawutisa khona batsho uba no asizuqala ngawe bathini na since sisebenzise kwesi sibhedlele makunyamezelwe. Banyamezela ndabona uba kwabona ke ngoku sebephuma out of izandla zaba no kaloku isinafu kwakunothi dinga we-10 kuyothathwa umntu we-15 bazange bayithande apho kwakhona i-argument ke iyayikhona nabo ke bayazama undikhumbuza uba le argument was uba babecacisela zanesi uba anikwazi kaloku nimbona umntu uba akekho rayithi nibe niphinde nonceda abantu abafike before yena. But ke unfortunately noba ke yaye sebenza lo drug ngolunye uhlobo then apha ke noko ndizama ubuya kwi-senses zam. Yeah, mna zange ndibe safuna ungena because ndaye ndabona uba xa sekukho la argument ke undiziva ndaye endlini ndafika ndake ndahlala endlini ndarelaxa. No zange ndibuyele ekliniki qha ndaye ndacetyiswa uba makhe ndiyeke nam ke ndake ndayeka ndazama ufowukhasa kwizinto. Mna ngokokwazi kwam nokuzibonela kwam ndingathi no kliniki ayilothemba because kaloku ndisitsho nto is that immune system zabantu asifani maybe omnye kwayeswelekele kwaphaa ekliniki. Mna ngokokwazi kwam nakwi-age yam I think xa uaplaya for umsebenzi ne umzekelo inesi mos zi-epulela ubunesi bazinceda abantu zithini na and ke ngoku kweminye uyafunga uba nouzoyenza le nto le and xa uzoyenza willing uba uncede abantu. Mna ngazama ukuthi ingaske bayi-improve iservice yabo bangajaji abantu ngoba bebebona phaa bacinga uba bona abantu ba-important mhlawumbi ngabantu bapreg abantu abane-asthma okanye abanezi disease zabo okanye whatever izobe zezabo bangahandamine mhlawumbi ke abantu who use drugs. Yeah batrite wonke umntu ngokufanayo because ba-equal.
Eziba ndiyi-sex worker and ndatesta ndangu-negative three times. Ndayotesta ePefi clinic andaweka lokuqala ndaphinda ndayo kwesibini bathi abanayo prep because kwi-clinics esifumanayo sometimes enye ayifuni icondom yabona qombe mandizikhusele andawayeka la ngapha 2 times ndaqomba ndemalinde clinic semalinde ndawufumana ke phaa elizinto safe apha elokishini sesona naseziredzini ndiyamamela mos ngoprep bakukho into ekhuseleyo xa ungekho positive at least noko
ndingumntu otshaya ii-drugs. Into eyenzekayo ndathi nditshaye kanti ndiya-overdose. Ngoku ke into eyenzeka ndaya ekliniki. Xana ndifika ekliniki kwathiwa ekliniki eGombo ekliniki kwathiwa ndizenzile. So akho nto banoyenza bona. Ever since then ke ngozange ndiphinde ndilufumane uncedo uba nangosaqhubekeka kutshaya ii-drugs. Zange ndilufumane uncedo endandifuna uyolufuna njengamntu owaye wathi etshaya ndi-overdose ndamongoza ndathini. Kwafuneka ndidibanisene nekliniki sabakwazi undinceda ngoba kaloku babona uba ndi-overdosile nam ndayithetha inyani kodwa zange bakwazi undinika uncedo. Into ndayifumana kushawutwa. Akho nto ndiyifumanayo xa nokuba ndiyile ekliniki. Andifumani zi-injection, andifumani zinudle, akho nto ndizifumanayo, akho nto ndiyifumanayo xa ndiye ekliniki njengamntu utshaya ii-drugs.
Ndisexwehla ne. I started noba ndina 30 years ndisenza le business. Na 30 years ndisenza le business. Now ndisela ii-ARVs. Yabo. Kodwa ke kwezo ARVs siya-defaulta guys thina sizi-sex workers because asikwazi ukumelana nemini sifolile. Ingase thina ufumane iipilisi zakho uhambe. Or else njengokuba kukho imibutho ethi yasisebenzela ingaske sifumane mobile. Yabo ikwazi ukuthini uzosidelivera iipilisi zethu siyazi uba ngemini ethile izawufika imobile. Nothi le nto sithathe sontlambalazo kuthiwa siyarapha basekogqirha sithi xa sifikayo phaa sijongwe ngabantu bonke uba nazi ii-sex workers nazi ii-sex workers. Ayikho mandi loo nto leyo nathi kaloku singabantu umama babantu. Jonga uyabona mna ndidefaultile. Ndadefaulta 2021. Loko nditya iipilisi zabantu. Pilisi yomntu uba ndayazi ipilisi yantothini. Buyibekile phaa ndayazi uba ipilisi yantoni na ndizawuyiba. Ngulowo nolowo nothi uyathanda ulinda. Asithandi ulinda because sicinga ngexesha lozosebenza ibhizinesi yethu. Mobile clinic ize kwezi ndawo siba kuzo. Asonqeni uba siphinde siyothesta tsalwa amagazi kujongwe isitfoka because yindawo kakade sithanda sisipoti sethu.
I'm a sex worker. Ndihlala apha etawuni. So ixesha elininzi andinalo ixesha loba ndiye ekliniki. When it comes ndisiya ekliniki siyalibaziseka. Ekulibazisekeni kwethu ke ngoku phaya ibhizinesi ke ngomna iyandishiya apho sithengisa khona. So ndiphela ke ngoku ndiba yi-defaulter ndingazikosakwazi uba ndiyothatha ii-ARVs zam ekliniki. Ikliniki yam endiyisebenzisayo yi-Central Clinic eMdantsane. Ne-viral load zam andikwazi uba ndibe ndiyazilandelelela ngoba kaloku ndisoloko ndilapha uba ndenza imali uba ndilale ndityile. And then ke ngoku ndineminyaka ezintathu ndingasayithathi i-treatment and ne-mobile clinic ke ngoku ayisizeli apha kule ndawo sikuyo noxa isazi uba silapha. So siyasokola ke ngoba sibe kanti sinamathuba ke ngofumana i-treatment sethu nto ndidefaulthe ngolo hlobo. Ke ingxaki leyo uba kungaziwa qha sikwazi uba sifumane uncedo lwethu kule ndawo sikuyo.
Esami story mna sokuba xa uye ekliniki ndihamba kula kliniki phaka 1.
I go to clinic at 1.
Uzofika phaya zingekho lubricants even condoms ezi.
When I reach there, I don't find any condoms or any lubricants.
Yingxaki ke leyo ngoba kaloku kufuneka sisebenzise into esidibisene Vaseline xa usenza laa mcimbi okanye idon. Zezi ke zisinika ingxaki ngoba kaloku sowuphuma uzowuziva uba uphuma amaqhuma mhlambi i-piles okokoko ngenxa yoba zingafumaneki ilanto i-lubricants.
And this is a major problem for me specifically, especially when I'm doing sexual intercourse, because you'll find that my piles frequently come out and you have lumps that you don't know in your anal.
So ndingacela uba i-Department of Health isincede nge-lubricants soloko zifike ezikliniki zikhona. Enkosi.
So I'm humbly requesting for the Department of Health to provide us with condoms and lubricants at our facilities.
Molweni,
Mna ndikhe ndafumana i-challenge phaa kulaa clinic ise-NU12.
I once encountered a challenge at a clinic at NU12.
Ndandifike phayana ndiyothatha iipilisi.
I went there to collect my pills.
So ndafike ngoku lo sisi ubhalisayo phana engekho.
When I arrived there, there was no one at registration or reception.
Phofu ke engekho nje ixesha lakhe le-lunch belingekafiki but ndafika sekusiwa uselunchini earlier.
And even though I reached there while she was not available, it was not yet a time for lunch, but I was told she went out for lunch.
Wabuya ke ndabhalisa fine kwabikho nto sekudala.
When she arrived, I got to register, and that was fun, but it took a long time.
So ndiye ndafika phayana ke kudala kukho abantu bebehleli phaa phandle balinde iipilisi zabo bengade bazifumane.
When I got there, I reached a number of people waiting for their pills, but they did not receive them yet.
Wabe umuntu okhupha iipilisi ukhona apha ngaphakathi ekliniki but akasebenzi uyazulazula.
And yet the person responsible for dispensing the pills was around in the facility, but not paying attention to anyone.
So ke ndiyamcela ke mna kuba ndicela andinike iipilisi.
I decided to approach the person and ask for my pills.
Ngoba ndisemsebenzini andizokwazi uhlala.
Because I was still at work and I was not going to be able to wait for the pills.
So la bhuti wandixela into yokubana mandifane nabanye abantu ndihlale esitulweni ndilinde ubizo.
So he told me that I should do what everyone else is doing and just wait for him to call me.
Phofu wabe wona umqulu weencwadi uhleli but akho nto ayenzayo ngawo.
And there were many cards in front of him, but he was doing nothing about them.
So saye sanyukelana ke ngoku besithi andimnambeko andimhloniphanga.
We ended up arguing, and he told me that I was not respecting him.
Ndibuze ke mna ubana ndizawuthini because baloku ixesha ndisemsebenzini ndicela undinike iipilisi ndizohamba.
So I asked him, what else can I do, because I was still at work. He must just give me my pills and I will leave.
So into endayenza ndacela umuntu ophetheyo ke phayana kulaa clinic.
So I decided to approach the facility manager.
Then wabuza uba ndizamthini na into endiyifunayo kuye.
The facility manager asked what I wanted with him or her.
Ndamxela ke mna kuba ndinale ngxaki ipha sefront.
So I told her that I have a problem at the reception.
So wathi ke la sisi uyimanager ke mandikhuphe amakhadi wam phayana ndimnike direct straight ndithi kuye andinike ezi pilisi ndizifunayo ndizohamba.
So she asked for me to give her my clinic card so that she can help me herself.
So ke wandixela ke lobhuti uba loo nto uzithembile kwedina unambeko nanoba yintoni le unethemba layo.
And the man at dispensary told me that I was very sure of myself and disrespectful towards him.
Ndabe ndimxela kuba hayi kaloku umntu ndifuna nje uba ndifumane iipilisi ndizobheka emsebenzini.
I told them that all I wanted was my treatment so that I can go back to work.
Ndaphela ndizifumana ke but into endaxela yona kuba andiphindi ndiye kulaa klinikhi yakwa-12.
So he ended up giving him my treatment, and I told myself that I'm never going back there again. Thank you.
Thank you. On that banner, we demand dignity for all. And this dignity for all is it demandayo. It's not something that is coming from heaven. It is there in the Constitution, in the Bill of Rights. They are listed there. But often, people living with HIV and key populations, your MSM, sex workers, people who are using drugs, you name them all, even young people, their rights are often violated in our facilities. They are being discriminated, stigmatized, they are belittled, they are made to feel small. And as the result of that, instead of people fighting with health workers, they decide to disengage and not to go to these health establishments again. And the question I'm asking myself, if the majority of the public healthcare users, all of them, or half of them can decide not to go to clinics, who is going to pay for our nurses and why they should be paid for not serving the people? Because we are their clients. And if we, as their clients, are not happy with their services, what must we do? Must we fight against them? No, because we will be arrested and we will be accused of taking law into our hands. But when our rights as people living with HIV and key populations are violated, nobody is holding them accountable. And as the result of that, Usiswa mentioned that because of the frustration and the trauma they experienced inside the facility, they decided to go and buy ARVs that are given for free. It's not because they've got planned, but what is important to them is to get the life-saving treatment. And for sure, the money they are using to buy ARVs, that money could have been used somewhere. And if I was a health official here in this meeting, before this meeting finishes or after it finishes, I was going to go to SIS and get her details and the name of the facility to make sure that they stop buying ARVs that are free, to make sure that herself and the person that she represented there are no longer frustrated and ending up to pay medicines. If I was a health official, I was going to go to all people who shared their stories here. Even if it's something which happened 3 months back. But isnxephezelo is important. When we talk about isxephezelo, we don't talk about money. For God's sake, we had F.W. de Klerk who murdered our people. And it was easy for us to forgive him, even though we never forgot. And all what we are asking is what is written there. We demand dignity for all. If all these comrades who are here were to be taken back to those facilities and make them see to say, even if there are no punitive measures, but to say, I'm sorry, it brings back hope and confidence to you as an individual. You feel respected. I so wish that these stories will be followed, and some of the stories, if not all, are going to be attended to. More especially that Nonjajambo. That Nonjajambo needs to be attended to. Because by what I'm getting here, there is a gross violation of human rights perpetuated by some people working there. And those people who are working there, they've got family members who are poor like us, who are public healthcare users like us. Usisiwam is saying a nurse stole ARVs to give to her. As much as we can say what that nurse did was a crime, she did a crime for a good cause, to save a life. If I was a nurse, seeing that, I was going to steal ARVs to give to her as well, because what is important, she was able to get the life-saving medication. Are we saying our people must go through this in a democratic dispensation? This is bad. This is bad, not only to the government, but to those people. Not all nurses are bad. It is bad to those nurses who are doing their good work. Because when complaints like this are coming, they are not specific to say, Unes aneleyaw. They just say Unes. And then Unes Belinda, who's doing good, is hotspotting the feelings because kuthiwe nurses. And if bekuthiwe Unes aneleyaw, it was going to be easy for those in authority to deal with Unes aneleyaw. But some of the nurses, they don't wear their name tags because they know they are rude. And when they wear their name tags, we will identify them easily and report them. But because they know that they are rotten potatoes, they decide not to wear name tags, and we find ourselves in meetings like this generalizing. I think wearing a name tag is part of the Batopile principles. And as a manager or a supervisor, when you enter into a facility, you see your staff not adhering to everything that is there. What do we do? But also we as the community, we need, as a matter of urgency, to meet with these trade unions of the nurses. You name them all. So that we can engage with them. To say, your members, when they demand their rights, they expect our support as communities, as civil society and other organizations, forgetting that the support they ask from us, we are the same people who are victimized by them. So how do they expect us to support their struggles? I think we need to make them understand, but also the authorities, district managers, host managers, what managers. I think in your meetings with facility managers, you need to talk to facility managers and give them some reflections about their staff. Because in old days, before Ritshidze came into the picture, we used to report about these things. We were accused, Comrade Tandukol. We were told that we are generalizing. I remember myself fighting with Anpan Pillay at the national office about shortages of medicines. He said I was hallucinating. Yet, when I was in an interview, I was at Letitia Pamkonobut talking about something that was happening in front of me. Yet, he was talking about something that was on the system. What is on the system? On the system can say you've got enough medicines. But when you go to the facility, on the shelves, there is nothing. So these are two different things. For God's sake, good people of God, I do not know about other comrades. I'm tired of fighting against the system. But it does not mean if I am pushed to that level, we won't fight against the system again. And when we fight against the system, we will be accused again. Because when we fight against the system, we will use all means available at our disposal. Courts of law, civil disobedience, breaking the law. Personally, I'm not tired. I'm not scared of being arrested for a good cause. And I'm sure many of us as the people, we are not scared of being arrested for a good cause. I'm sure healthcare services in prison are better than healthcare services outside prison. And now many people are pushed to commit crime so that they can live a better life in prisons. Is that what we want? These are some of the things that we make, not of our own choice or making, but the conditions on the ground are forcing the majority of the people to commit these crimes. You heard Comrade on the video, one of the people who are using drugs, telling you the experience that he went through. In some instances, people who are using drugs and sex workers, when they go to the facility, they are being chased away and told, go and take a bath first before we can serve you. These are the things that people are experiencing. When young people go to our facilities for e-services on termination of pregnancy, instead of them being given services, they are being converted and made to believe in religious beliefs of the health provider. They are being told, gays and lesbians, how are they not going to enter heaven? For God's sake, if you are a preacher person, go to church. At the facility, don't advance your religious or cultural beliefs. All what is expected from you is to stick on the standard operating procedures that were given to you by the government. If you are unable, just resign. There are a lot of students here who are qualified as nurses and who are eager and willing to serve our people. But at some point, something needs to be done. Because I'm sure after this meeting, nothing is going to happen. And then I'm expected to come again here, share a meeting with the same stories. Me and you, Comrade Tankolo, were here last year, June. Same stories were presented. And in that meeting, Mr. Somayela was there. But from where I'm seated, things are worse as compared to last year. And I'm expected again to come here, spend 4 hours sharing these meetings. Something must be done. Heads must roll. Rotten potatoes must be eliminated from the system so that our system can have committed and dedicated cadres who are willing to serve the people. The recommendations are as follows. The Department of Health should ensure that all clinical and non-clinical staff, including security guards across public health facilities, are sensitized on provision of key population-friendly services to ensure a welcoming and safe environment for all key populations at all times. Key populations must be involved in the implementation of these training modules. Any reports of poor staff attitudes, privacy violation, verbal or physical abuse or treatment and or of services being restricted or refused should be urgently investigated. The Department of Health and PEPFAR should expand the Centers of Excellence model to ensure that at least 2 public health facilities per population in Buffalo City serve as key population designated service delivery centers. A minimum package of services should be made available at these facilities as outlined in the State of Health report. Easy referral and adequate resources, including transport or money for transport, must be provided for people to take up these services. PEPFAR must support these facilities with additional key population-friendly staff and resources to provide comprehensive health services to the specific key population being served. Ensure that HIV prevention tools, including lubricants, external and internal condoms, PrEP, and PEP are made easily available at all public health facilities. Make available external and internal condoms as well as lubricants in a range of spaces across the facility. For an example, waiting areas, toilets, gates, pharmacy, consultation rooms, quiet areas out of sight, so that people can freely and easily collect them. Ensure that PrEP is offered to everyone, including key population who are not living with HIV or testing negative for HIV, with information shared on its benefits. Ensure that all facilities provide gender-affirming services, including using trans people's correct names and pronouns, providing a gender-neutral toilet for trans people, respectfully asking trans people which color folder they are more comfortable using, maybe pink or blue or any other color, ensuring that trans women are not made to use men's corners, maintaining privacy and confidentiality. Additional healthcare workers and clinic staff should not be called into consultation rooms under the guise of helping, when often this is to mock and judge trans people. Siyangaphi? We're going to infrastructure and cleanliness.
Okay. The next set of issues are on infrastructure and cleanliness. The country's load shedding crisis negatively impacts the provision of healthcare in our clinics and can often lead to people waiting much longer to collect medicines or consult in a clinician. In Buffalo City, the most common challenges include data capturers not being able to capture information, creating a backlog, and impacting follow-up with people who have missed appointments, and other recall system, and delays in finding files when filing rooms are in darkness. Generators at each facility should resolve these challenges, yet only 27% of facilities reported having a generator that is working and has fuel. 9% of facilities monitored in Buffalo City were observed to be in a good condition, down from 40% last year. The most common reasons for poor clinic conditions were due to buildings being old and in need of renovations. 82% of facilities reported needing more spaces with waiting space, rooms for medical care, rooms for private HIV testing, counseling, given at the most common things facilities needed extra space for, impacting negatively on congestion, TB infection control, and privacy. On overall cleanliness, 67% of public health care users reported that facilities were very clean, while 5% reported that facilities were very dirty or dirty. 91% of clinic observed found that toilets were in bad condition, with no toilet paper, no soap given as the most common reasons. We will now move to the recorded community stories.
So iklinikhi apha qho kandisiza apha iklinikhi yalapha eDreamfields qho kandisiza apha akho hoyo okokuqala uyafika apha noma ufike ngo-8 uyamka ngo-3 ngeli xesha awunayo nemali yoba utye ngeli xesha awunayo nelantshi ulambi apha asikwazi wasela la manzi asinayo itepa asinatanki asinantoni siyasafarisha nje kule klinikhi asinahoyo asihoyo xa kunetha sihlala apha phandle kubanda upha phandle kushushu upha phandle ayifani nakwezinye iikliniki niyenzela isuphu ikofu nitye because of ubana ixesha isenza loo nto leyo sizifile ingathi asikhathalelekanga then isenza loo nto leyo thina singabantu abatya itreatment sidefault singabantu abahlabisayo asikwazi umntu azixelele ubana ngaba soze kalo mna ndiyogcaba phaa kukunetha imvula ndingathanda okokuqala khe senzelwe ikliniki nothi la endawo sikuyo ayokliniki laa nto le uba uhlale phandle ungene kwikhonteyina ayokliniki khe sibe neholo lethu elizawuba yikliniki noba kuyanetha siyazazi uba siseyifu singaphakathi uzawukhwazwa uye kwelo gumbi ukhwazwa uye kwelo gumbi kongezwe nestafu.
Oh, thank you. As Conin's as the recommendations. You know, I will keep on calling you Comrade Tandukon. I also serve, as I said earlier on, the Office of Health Standards Compliance. E-duty to PANA is all around inspection and certification of health establishments that are compliant to norms and health standards. And according to the NHI bill, in order for a health establishment to qualify for the NHI fund, they need to get a 4-year certificate from the Office of Health Standard Compliance, both in private and in public. And in South Africa, we've got about 3,800 health establishments, public. I'm not talking about the private and the GPs. If we were to include private and the GPs, I'm sure we are more than 25,000. All of them are supposed to be inspected and certified by that institution. And when you look at the number of health establishments in the country that are compliant and who have been issued with certificates, you begin to realize that for the black communities, NHI will be a deferred dream. Because in the country, for this financial year, we've got less than 500 health establishments that are compliant. And as the result of that now, we are busy trying to promulgate some rules that will include punitive measures against health establishments that are not compliant to norms and standards. Clinics now will have to pay money if they were inspected and they were not compliant, re-inspected, not compliant. Now heads must roll. And we are pushing that, and I'm one of the people who are behind that. Because I know that the powers of the Minister of Health around issues of budgets in the province, hiring and firing, purchase of health services and goods, renovations of buildings and all, those powers do not lie with the Minister of Health. They lie with the provinces. And if provinces are not fixing our health establishments, fixing the infrastructure, it therefore means NHI will be something that we see in TV. The only health establishments that will be able to implement NHI within a blink of an eye are private health establishments or net care, those that are under net care and all what have you. And we will blame government. Yet those who are appointed to manage or mismanage our health system are not doing what is expected from them to improve the quality and the standard of the infrastructure. The Department of Health should ensure that all public health facilities have a functional generator with sufficient fuel and rechargeable bulbs so that health services and administrative work can continue during load shedding. Ensure that all public health care users are consulted, tested, and or counseled in private rooms. Carry out an audit of all facilities to assess infrastructural challenges, after which the department should develop a plan in order to renovate buildings and ensure adequate space to provide efficient, private, and safe healthcare services. The department must publish the results of this audit. In the interim, provide temporary structures and ensure that more people living with HIV are being decanted out of the facility and receiving longer ART refills to reduce the burden on overcrowded clinics. Ensure that all facilities are maintained to the highest standards of cleanliness, including through implementing regular cleaning rotas. Ensure clinics have resources to provide soap and toilet paper in all toilets.
The next group of issues are TB infection control. In South Africa, around 300,000 people developed tuberculosis every year, and about 56,000 people die. Yet TB infection control in our public health facilities remain inadequate. By following a simple checklist of good practice, including key measures that were implemented during COVID-19, facilities can be safer for public health users and staff. With the checklist in mind, Ritshidze has developed a scorecard and a traffic light system to rate clinics on how good their TB infection control is. Clinics that adhere to all the measures are given a green light. Those that are on the right track but still off target to get a yellow light. And the red light is given to those that are way off mark on ticking the checklist for 6 measures. In July and August 2023, 0 facilities awarded green status for checking all 6 measures on the scorecard. One facility was awarded yellow status for following about half of the best practice measures for infection control. 10 facilities surveyed failed altogether at meeting these 6 basic practices to stop the spread of TB.
Thank you. Noloyiso. 2021, as TAC and people living with HIV, we marched to Udidi Mabuza as the Deputy President and the Chairperson of the South African National AIDS Council, including Uzweli Mkhize, before a scandal said Digital Vibes. We marched to Mbombela because we felt that our government is not paying attention in our country's response to tuberculosis. We demanded that our government must do to TB what they did to COVID, including providing leadership, injecting more resources and all what have you, And among other things that we asked was to say, we saw during COVID, Uzweli Mkhize as the minister, frequently going to the media telling the public ukuthi, how many people got infected with COVID, how many who have recovered, and how many who are hospitalized. But we do not see that on TB. And when you look at the number of ARVs that are available for HIV response versus tuberculosis, tuberculosis, it is older than all of us here. And yet, the TB treatment that we have for TB, it's old treatment, and the effective and available is too expensive. That's why companies like Johnson & Johnson are trying to monopolize the whole process in order for them to make profit out of our lives. One of the things that we demanded was to say, during COVID, we saw in banks everywhere, on point of entry, you will be screened for COVID. But we do not see this happening in our health establishments, where when people enter, they are being screened for tuberculosis. We've got many people who have defaulted on TB, and nothing is being done about that. TB remains one of the main killer diseases in South Africa, and nobody cares to pay attention to that. Because why? Majority of the people who contract tuberculosis are poor and cannot afford. That's why it was easy for our government and the whole world leaders to come up with vaccines for COVID, because COVID affected the capitalists. It affected Abo Ramaphosa and all of them. That's why they had to come up with vaccines quickly. And with regards to TB, they don't care. You go here in South Africa, you go to Brazil, you go to India, you go everywhere. Majority of the people who continuously die of TB are poor people, abahlala emikhukhwini, abahlala kwindawo ezinamanzi adamileyo, and all what have you. We've got a problem, comrades. And I do not know why health department and environmental department were not merged together to be the same department. Because the problem we have, even in the process of NHI, comrade Thandukol, our NHI is only focusing on curative measures and methods, not preventative methods. We are being made to be sick to get to hospital in order for us to get services. Yet we do not want to be sick. But if you were to go to our townships, how many dumping sites? And people are congested. RDP, forum, the house of RDP, kuhlala abantu by 8. And you are expected to combat TB. When you cough, you are not treated as a priority at the facility level. We need to pay more attention on TB the same way we are doing to HIV and COVID-19. Here are the recommendations. The Department of Health must issue a communication to all facilities stating that all windows must be kept open. TB infection control posters must be displayed in visible places in the waiting area. Public healthcare users must be screened for TB symptoms upon arrival. People coughing or with TB symptoms must be seen first to reduce risk of transmission. People coughing or with TB symptoms must be provided with masks. People who are coughing must be separated from those who are not while waiting. Carry out a full audit of all public health facilities in the province to assess TB infection control based upon World Health Organization guidelines, after which the department should develop a plan based upon the infrastructural, human resource or behavioral change found in order to improve TB infection control. The department must publish the audit results so that all of us, we know of what is happening on TB. Without wasting any further time, I will now call upon the leaders of the 4 PLHIV sector organizations A report has been presented, people have spoken, and then I will ask each one of you, comrades, not to be like me and talk too much. Now I know good I'm paid to talk too much. So I will ask you, comrades, not to take more than 3 minutes. Sizawuqala ngawe mfundisi wami. Thixo akusekelele mfundisi.
Thank you. I always speak just like you, Comrade Anel. Speak from the heart, but I was warned by somebody, said, no, at least if it's 3 minutes, just write something to talk about. I'm Zuzo Novuga from INAPOA, the National Association of People Living with HIV and AIDS. Yes, the report, the report is giving us a great picture of what is really happening in our facilities and in our communities. And this will enable us to have an informed response so that we can plan according to the needs of the clients. Because seemingly, the people who are planning for a response as clinics to ingati aitatwa from an informed report just like this one. We need at least ngokusiyazi ukuthi abantu bafuna ndoni. Singayenza njani because there's no need yale clash ingaka. Ndake ndafunda kwesinye isikolo phakathi Alex Jaya. Next door kwasekhaya there was umama omdala called to Miss Ntuntwana. Ndihlala kwa number 16 engane kwaZodwa. Kukho into ayibhaliwe pha ebhodini kwasasikole elidongeni ethi Blake lesam and Friete hlalisanani ngoxolo, live together in peace. We act as if we don't know each other, Mamuseli. I don't know, no matter it's the system was meant for bakube njalo. But please, let's stop it. Let's stop it because if you don't give me a full service, ndivizitele facility, you don't know, Comrade Titi, ukuthi maybe I'm your son-in-law. Maybe there's something I'm doing with your daughter, and then you should change me in service. But beyond, whatever we do, let's make sure sense into right, because we don't know ukuthi kwenzeka ntoni na. If a system doesn't want to change, we will get our own system, Comrade Titi. If they call us NGOs, we'll end up being GOs. Non-governmental organizations now will end up scrapping that N and will be GOs. The governing organizations, one day, they must enforce us. Because if you talk about 8 million of people living with HIV and AIDS, if we are a GO, a governing organization, it means we'll have support one day. So whatever is happening here, people must enforce us. We've got the numbers. As you can see now, we've got the systems. Ritshidze is one of them. I know we once have stigma index. People will always pretend as if, Comrade Anele, they welcome whatever we are doing, but they know within 2 years, they will put it under shelf, even Ritshidze, if we are not aware. So, comrades, let us be cautious. We need to be very, very, very cautious. We know this movie will come with efforts and come with evidence. People will say, no, this is wow, taking pictures and slogans and whatsoever. But I know within a period of 2 years, I'll just put it under shelves, whatever people are doing. Oh. There are slogans, there are so many slogans here. Quality health care for all. We will overhaul the health system, re-engineering of the health system. We've been hearing about this, but follow that there's no implementation. It's always rhetoric. We need to have our own system that will talk to us. That's what we need to do. I think we need to, Comrade Anele, to understand each other. People will say, let us create a demand. We create that demand, but there is a lack or shortage of supply. And even the suppliers seem not to know what to do. You call them the providers of the healthcare system. They seem not to know what is really happening. So we need to come and sit together and then just say, this is what we want. Let's come up with new ideas that will challenge the old way of thinking. Let us come up with new ways. We can't expect to say, we've been doing TB in 1946. Still now, let us change these systems. Let us come up with things that will respond to the needs of the people. I'm not going to say much because sometimes I doubt that the information is being disseminated to its juniors. People will attend meetings, and then you'll find in facilities people do not know about these new developments or guidelines. I don't know really, but we need to come up with a new way and do things differently. I think let us put more action on women who are living with HIV, and it's double, and then they have cancer. There are women with cancer living with HIV, and then it's a time bomb. It's a time bomb, so we need to put more focus on that. And how I so wish that we can take this report forward, really, and respect it, and give it that respect it deserves. Because definitely what Ritshidze azenayo into, it seems that health promotion is dead in our country. You can't wait to go to a health facility in order to see a poster talking about TB. So we need to appeal to our government, put more money and put more emphasis on health promotion. And even I can even ask the Department of Health to assist us. Maybe employ people to be health promoters, taking them from even a sector of people living with HIV and AIDS. It seems that people, when they go to facilities, the reason they clash with nurses is because there is a gap when it comes to health promotion. We need at least now, people must go to facilities aware of what is going to them. And then so that it will be easy for the service to be given to them. Let me stop there. But what I would like to say, a big ups to Ritshidze. But let's guard against. We mustn't be complacent. Because I know this. I know this movie. Please, let's guard it. Thank you.
Thank you, Mfundisi wam. Ngoku ndizabiza uComrade Ncedisa Zinyani. Yabona ke Comrade Ncedisa anzohlala phansi ngoku. So that manje ukujonga. Umfundisi khange nikwazi ukumenza le because sicaka senkosi.
Molweni bethunana, igama lam ndinguNcedisa from OPWN. And as PWN, we support Ritshidze with human rights and with human rights at facilities based. It's either hospital or clinic. such as long waiting periods. Lanto ba nifike ekliniki kusasa, nihambe late, mhlawumbe nihambe ngamanye amaxesha ningancedakala. I-bad staff attitude. La attitude uthi ufikile ekliniki uzama ukumcacisela unesi ngengxaki yakho ayithethele phezulu wena ububuyithethela ezantsi. I-infrastructure yes facility esihamba kuzo ingase ibe yi-infrastructure right for abantu. Nalando yokujikisa ama-patient because bamisisha i-dates zabo. Kuyenzeka ba sometimes umisisha i-date ngesizathu esivakalayo, but into siyifumane i-right abantu baye bangabi nazo ngoba kaloku unesi ufumanise kuba akafuni umamela isizathu sakho kuba sithini ukuze ube awuyi-honorishanga i-date yakho. Enye into nale yokujikisa i-patient kuba usithi abane transfer letter umuntu makajike ayothatha i-transfer letter apho bekethatha khona i-treatment irongo naleyo, which is i-rights zabantu ziyanyashwa kwezi facilities. I-self transfer ins kwi-facilities kwizibhedlela fanele zamkelwe nazo because sometimes uyakwazi uhamba kule ndawo ubuhlala kuyo ungakwazanga uyothatha i-transfer letter apho ubuthatha khona i-medication, of which unayo i-right yokufumana i-medication noba kweyiphi na indawo ngaphandle kwe-transfer letter. Into yenza ba ndithi as a rights kufanele zijongiwe. If iyaqhubeka iyenzeka lento ziye zinyuka abantu abadefaultayo ngenxa ye-treatment abazifumana kwezi public athi umuntu hayi ngcono ndiyeke i-treatment ndingayithathi, ufumanise ukuba uyagula ngamanye amaxesha deep down yena uyafuna uthatha i-treatment qha akakwazi ke ngoku because of i-bad staff attitude. Into futhi lento yoba kunyashwa amalungelo abantu decide uba babe abayi kwi-facilities iphinde bachane nabo kwi-facilities because baye bafumanise ukuba babane-loss to follow up. Ufumanise ukuba ke ngoku kufuneka kulandelelwe uba umntu ithini into yakhe, then xa seyifumaniseka no man lo mntu uyayifuna i-treatment qha i-rights zakhe ziyanyashwa kwezi facilities. So ndi-PWN ndime apha ndithi ungumntu mna ndakhuliswa kusithiwa umntu mazi, andikhathali noba ungunesi lazi i-patient xa uli-patient mazi unesi because sisonke singasebenzisana futhi singayinqoba lento. Mazi umntu noba uyintoni noba ungubani waphi kodwa mazi omnye umntu. Amandla ndiyaphela apha.
Thank you, Comrade Ritshidze. Without wasting any time, I will call upon Comrade Nobesuthu Skei to come forward. Comrade Nobesuthu Skei from Sanarela. Ingabukhona? Akekho? Oh. Then ndizawubiza uComrade Ngobuntu Mqheba. uComrade Ngobuntu kuthe yena seyityiwe yonke uzawushaya 2 minutes. So that sibe nokwazi umamela kwi-department xa irespond. Comrade, imic yakho. Duma mina weteke duma mina. Duma mina weteke duma mandla.
Ndiyazibulisela namo ezibabe kutshiwo kwathiwa igama lam ndinguNgobuntu Mqheba. Ndisuka kwa-Treatment Action Campaign, umbutho wethu ulwela amalungelo wabantu abaphila nentsholongwane kagawulayo. Anzoyitsala serious. Ndifuna uthetha kakuhle. Thina siyi-PLHIV sector siyahamba siyadibana nomama mabandla siyasebenzisana kunye ne-district manager futhi siphuma sixolile kungekho nto isikhalazisayo. Kodwa ke kukho lento into yobana ngaba xa singena kwii-facilities asiyifumani joy. Into esiyifumanayo kubana ngaba singaphatheki ngendlela right. Kodwa ke kuba ke thina isithi ngoba thina unobangela kanti ARVs zikhona ziyatyiwa ngumuntu uyaphila ixesha elide. Sadotyulwa siphepha neembumbulu eQueenstown ngapha. So siyayigxininisisa into yobana ngaba umama Mabandla siyamcela torho akathethe phaa egrawundini akazama uthethathethana nee-facilities bana ngaba noko ngabantu nabo aba makhanibaphathe kakuhle as babezama uncedisana kunye nani. Bhuti Thando siyacela torho kukho i-Rest in Dice, kukho i-New Life. E-New Life nase-Rest in Dice kuhamba i-mobile clinics. Into esiyicelayo sicela into enye into yobana ngaba i-mobile clinics into eziyenzayo zihlala u-3 hours. And ke ngoku ngamanye amaxesha ke abanye abantu baphuma emisebenzini babe besithi bayaleqa baleqa imobile bafike ingekho seyimkile. Siyacela noko ikhihlale noba ngu-5 hours at least. Futhi kwakwezi mobile clinics sicela ibe i-mobile clinic ibe fully equipped ngoba kukho abantu abasokolayo ukubheka konontyatyambo ukuya nakomadeyi for bana bafuneka beyotsala amagazi. Siyacela bethuna into yobana ngaba ii-mobile clinics zisitsalisa amagazi ngoba imali ayikho. Enye into endifuna uthetha ngaba lost to follow baninzi kangaka i-18,000 yonke ephondweni lethu. It's too much. And njengobana ngabe i-18,000 nje kukho ii-clinics ezithi abadefaultayo ngapha. Ii-defaultees sizifuna kwi-backline. Sinaloo ngxaki, sizama ulwa naloo ngxaki. Kudala sizama uthetha kunye no-in charge eziklinik ba bethuna nasicela into yobana ngaba ukwenza zingandi ii-defaulters abantu sanibaphatha ngolu hlobo. Ezi zitori zingaka zivisa kabuhlungu. And ke ngoku thina singuthekhi siyafuna uncedisana kunye nani niyi-department. Siyafuna uncedisana nani siyi-department into yobana ngaba even aba-lost to follow thina siyabazi aba-lost to follow bangobani na. And ayingomsebenzi wethu ukubana ngaba masilandelele emva ko-lost to follow qha kuba sizondelele iimpilo zabantu. So ndiyacela into yobana ngaba khanikhe nizame uthetha egrawundini kwii-facilities zethu esihamba kuzo ubana ngaba abantu mabangabaniki i-bad attitudes because sekugcwele 18,000 bo-lost to follow nje kungenxa ye-bad attitudes zestaff. Enkosi ndiyabulela.
Thank you, Ngokeli. So now we are moving towards the end, but we are not yet there. So we will call for someone from match, if ukona, and then after match it will be a Department of Health, and then after the Department of Health we will close the meeting. Over to you, match.
When you kalelane, when you kalelane,
Tulamdanam when you kalelane.
Amandla. My name is Faith Wagwatango. I work for Match at the head office. Supporting a team yase PCM. I'm with Sonabile here. As a nurse standing here, I want to say, enixwile, enikfilile. It's not what as nurse esikplejayo maso sebenzisana nani. Ngifuna ukuthi nje nxa kube buhlungu to hear the experiences enwatholile egameni lethu singamanesi. Secretary, when you said we work with the Department of Health, a relationship here too. We need to come out, kube clear, ukuthi what do we do, not to be friends at the extent or at the expense of our patients. Yes, we maintain healthy working relations, but rest assured, not at the expense of the patients. So to mention that also you were asking if brother Utano Xolez, he's here from USAID, if USAID is aware of some of the issues that were reported here. We do have reporting structures where we report. I will even mention some of them that talks to a defaulting rate. Yama patients here we at, and we even had done an assessment. SRCBs and a little survey. We want to know why patients are missing appointments. And we have supported facilities with quality improvement plans to address those things. Department of Health, working with Seli, she's aware of those. We discuss that on continuous basis. The plea and the pledge was that we wanted also to work closely with Ritshidze when it comes to the dashboards, so that when we support Department of Health, we are able to address these gaps that are reported from the dashboard, so that the quality improvement plan not only developed, but the assistive department as we support them, which are implemented. I also want to mention some of the issues that are reported here. We have identified that it's not because Mam Seli or the leadership of BCM are not doing anything about, but as people get promoted, OOM bethu bayayidinga support yokuphatha. So some of it, we have a training as we speak that has about OM from 22 facilities. Ukuthi bacapacitate ukuthi ukuphathe facility kusho ukuthini, because it also take ukuthi account for all these things and prevent them, but address them as they come as well. I also wanted to mention the adherence club issues. We have identified from the assessment ukuthi ngenxa yama adherence clubs ama client set abe defaulter, and we started working with reviving ama adherence clubs. But not only that, monitoring ukuthi i-coordination yakhona ayibe ngathi umuntu uyothatha medication. They need to be supported ngokwe adherence. Mhlambe sengiya ngasekugcineni ngithi with uphela HIV sector also, we have started uzo attested to this UREF. We had a meeting with the PLHIV sector where we had committed to work together. Support abantu ukuthi sibanike adherence support, but also tracing and tracking them so that we bring them to care. I want to applaud you on what you said you had done with your team to also help us engaging or re-engaging patients to care. We really applaud you. But when it comes to the billing parts, I'm not around to give response to that. So I just wanted to mention that we are continuing to support the Nerve Center, Operational Putuma, which address all these things, Comrade SG. So as much we are committed to support Department of Health, but not at the expense of the patients. We are here to make sure we improve. Even if, as you were mentioning, I think, Comrade, when you were saying there is improvement, it is because some of these indicators, we've been addressing them with the department to assist in improving equality of care at Buffalo City Municipality. Thank you.
Thank you. Thank you, Mitch. I'm not going to comment now. Asibize wena mama. Asibize wena mama. Asibize wena mama. Take your time. Take your time. Calm down. If you want water, I can also give you it.
Yo, all right. Good afternoon, everyone. As I have indicated, I am Mrs. Selima Bandla. I'm coordinating the TB and HIV program for the district. Ndiphethe elacala lika TB and HIV. We are acknowledging the recommendations. And as part of Ritshidze, they can allude, in fact, they have alluded to the fact that things are not as before. We are trying, but the challenge is one rotten potato, it spoils the whole bag. We are trying, and being here, I am not going to defend or deny anything, but number one, I want to say, umntu ngumntu. Even if ngumntu that is in the facility, or it's a patient but umntu ngumntu, there are the challenges also around the patients. But the difference is, as a professional, you need to provide a quality service, which is comprehensive enough. So we can't, even if a client will come and say whatever, but you need to understand beyond what she is saying that there could be a problem and look for the problem. But you need, Anele, to understand that umntu ngumntu. We've been to the meetings, and at Buffalo City, I can proudly say we are almost there. We are sitting and discussing these challenges. And one of the activities that we said we need to take care of is education to the communities. You see? I was even saying to Ufaith, what I'm hearing here, it is mandanga. And I so wish even the 11 facilities, Anele, when we are calling these sessions, they are here. We've been saying that what we want, Tina, is to say, Enontyatjambo, on such and such a date and a time, this is what happened. We are following this, believe me, and they know they will agree with me. And when we are following these accusations, that is why now at least they are lessened. And when we are following them, we follow the facility, and when we are sitting with the cluster, we share this so that even the one who is thinking, or who is doing something, stop doing that, because we are called to serve the nation. We have the challenges that are infrastructural. Otherwise, with the medication, it is always available, I can't lie. But the infrastructural things, I once got a call from a client who is at Greenfields. She was saying, we are outside, it is raining, and when we are coming closer to the room, the door is closed. And I said, please assist us. Talk to the councillor for Greenfields to open the hall. The hall is closed, and the nurses are working in the bungalows. But if that hall, we can all negotiate to see to it that the hall is open, so that people, they are queuing inside the hall. They are taken in trenches, you see. So now, this is not only a problem of the Department of Health, Mr. Novuka, you know what I'm talking about. And as Metro AIDS Council, please assist us. A clinic for Greenfields, it was said is going to be built, but it's beyond our control. And we are saying, if we close services at Greenfields, where are the people going to access these services? Even for the nurses, you can see the conditions they are working under. There's no toilet. At times there's no water, and even those bungalows are leaking, but they are providing a service. What do you expect? Which service are you expecting in those conditions? You see, I'm not saying they shouldn't provide services. The facilities, I've enlisted them here, and we are going to follow them. And Unontyatjambo is on the top of the list, and nobody can lie about that. We are going to follow Unontyatjambo. Then it needs now, with the team that is supporting Buffalo City, Ritshidze, TAC, and all the sectors, we need to have a session for the feedback. so that now you can know that we are working. But as I am at the office, facilities, they know the posters that we're talking about, they are there in the facilities, you see. So we are both monitoring the facilities, and things are not the same. As I've indicated, you'll assist us now to say on such a date, like for instance, at Cambridge, it was indicated exactly who is the culprit, you see. So we are going to deal with Cambridge accordingly. And you are not supposed to buy medication. We do have medication. And everyone, as we usually do, all people, you can't risk your life because of facilities, what they are doing. We need to be responsible enough to see to it that you report these things. And believe me, we follow them. The transfer letter, it is needed, the transfer letter, so that we can continue with a client on the treatment that she is on. And now the system is assisting us because the transfer letter is in the system. And at PCM, in fact, in the province, we even say, if you want a transfer letter as the facility, we are struggling to go to get the number in that facility. Maybe it's in another district or it's another province. We are here as house managers. We know each other, we communicate, we go as far as Cape Town. We are assisting in facilities. And if we can't get any number, we are going to say, we are going to give you a treatment as umtu esemqalayo kodwa ne-experience, so that if mhlawumbi you are resistant, we know that you've been on the treatment. And Anele, 2 years back, we made a survey, and we were saying imbizos, asking from facilities, why are you accused of not attending to clients? And some other responses were saying, clients zithi, facility queues zinde. So what we do, siyahlala singayi ukwenzela uba niyosifuna. Siyayazi ke ngokuba xa niyosifuna sibaluleke gqitha sawufika sithi jump the queues and get treatment first. So there are also those things, which means us educating communities as the Mr. Novuka, the TAC, the NAPWA, and everyone, educating communities in their space, it is going to assist us. And us at the facilities, we are going to deal with the staff, because what they are doing is not acceptable. So I'm pleading and saying nobody must stop taking a treatment. We are assisting people through Onoloiso, and also the CPOs that are working with us, they see to it that they are supporting, as Faith has indicated, with the adherence clubs. We are moving, and we have started with our CPOs as centers. With the external pickup points, the challenge that we are having, they are concentrated in the city. And you can't say umtu from Devana must come to town in Kunglemstown to look for clicks to get medication. But what we are saying, at Ndevana CPO Empilisweni, they must assist clients with treatment. Then with tea and lunch that nurses are taking, everybody knows that we have to get food, we have to get a rest. But even when we were down there in the facilities, there was second tea, first lunch, second lunch. It is still happening like that. We can't leave clients not attended. There was an issue of e-filing system, which leads to clients staying in the facility for a long time. We have got e-filing system, But as we are having filing rooms that are small, we have now assisted and also discussed those issues via the Operation Putuma. We are saying the clients that have been transferred, we need to put them in a box. The clients that died, we need to put them in a box so that they are not in the midst of the clients that are coming more often. So we are trying our level best, and believe me, next year when we are having this session again, the challenges won't be as they are, because we are also improving on the sessions that we are sitting as the metro and also as the Ritshidze team. And also it makes me so, even the issue of NU9, guys, for a child to die on the way, being denied treatment, that I'm going to talk to the operation manager of the facility. The updated guidelines with support Kamech and the trainers for it department, all the facilities have been trained. They've got at least one for the clinics, but for the CHCs, they've got 3 that are trained. And now we are training the second round. And we say, a facility that has been trained has to start initiating. And the beauty in the guidelines, it's saying people first. So we are providing a people-centered approach. And you'll hear Dr. Ngumba saying, if a client, you say come on Friday, you don't say come on Friday, you say you need to come. Which day do you think it will suit you? Because we're considering the grant, people are working. It has to come from a client to say, now I'll be able to come on the 7th. Don't say come on the 1st. Yours is to count and have extra medication so that 7, it will suit her. And before the 7th, the client has got a responsibility to say, I won't be able to come because of A, B, C, and D. And it is said, alfakwa. So sifuna ususu alfakwa ke ngoku, so that we can be friends. You see, and if we go green in the board, that the green means we are providing a quality comprehensive service. So win-win. You see, so incinci ke lento funeka siyenzile ukwenzela ba at least sizothi go green and sibe ne clients zethu that are not missing appointment. And so I'm happy for being in this meeting because nditsho ndayibona ngokuba kutheni abantu bedefaulta. I was wondering, why are people defaulting? And we are going to work on that. With the condoms, they are always available. Even if we report 0 in the stores, but facilities, they do have the condoms. I don't want to deny, we've got a challenge with the lubricants, you see. We are working on that with the provincial office. Thank you very much, Ritshidze, for bringing this session. And I hope you will share with the district manager the soft copy. So district manager, what he does, he calls a meeting with the clinic supervisors and all the program managers. It is dissected, the report, and people are made to account. But I'm saying, unfortunately, in those meetings, communities, they are not there. Because I think them being here, hearing what we are saying, at least it will make umahluko. Please don't sit with thorns. Share with your teams. And if I don't mind my number, even if you call me, I don't have a problem. If you are calling me at night, but in the morning, the first thing that I will do, I will call you. Others can attest to that. And as I've indicated, it thresholds that was fun. Omnye is able to stomach what is happening, but at keep on providing the service. Omnye iyam affect. Health professionals zizingcwelecha. You see, in down there, but so far sisiya sizawufela emfazweni. So thank you very much. We are going to attend to this. We are going to share with you. Sivile bantu basemakhaya. And noloyiso, keep on sharing with us the people that have resorted to default. With the K-POPs, we are trying to attend to them. We've got the centers of excellence. We've got the partners that are specifically attending to them. We are providing e-mobiles for the program. We have not yet provided e-mobiles for the curative, but at most street, they are prioritized where they use. And also, unfortunately, even the green fields that we are attempting to close, it is also servicing the K-POPs and the truck drivers. I think also, Faith, what we need to do is to capacitate more on the drug users. It's not easy for them to come out, but it means we need to capacitate the nurses to see what is unsaid and not to be judgmental. You see, with these things, they find us here, and at times, even by age, kodwa nilapha ngoku uphinde uzilungise ube lapha siyayibona ezinto zisifumana silapha so sizawumane sigquduza kwezinye indawo but we will try our level best. What I've heard here is a mouthful. And I will start on Friday in a meeting with the CPOs and partners to share and say, let us assist each other and let us be eyes and ears for our people. Remember, Ritshidze for now is in 11 facilities. We are having 79 facilities in PCM. So it's for us now to share with other facilities as well what we have heard here. There are good practices in other facilities as well, and also in these facilities. But as I've said, one rotten potato, it will spoil all the potatoes. I hope district manager represented him well. Because I don't know, but it's out in the 10. Otherwise, thank you very much, everyone who is here.
Ngosi mama. Ngosi mama. I do not know, Mama, whether is there any other person from the department who was after when? Or Umama was the last speaker from the Department of Health. I'm not going to respond to match in the department except to say to you thank you. Uakhona, Belinda, and Unoloyiso are going to convene a meeting with the district manager, but we are going to share the soft copy with the district manager because there are a lot of issues that were discussed which are still pending, that are not yet resolved, which we think those needs to be brought to the attention of the district manager as well as sub-district managers. Also, on the issue of not inviting facility managers or OPMs, we're thinking about services to the people. We're fearing a situation where we invite them to these meetings because these meetings have a tendency of taking long. And if they are sitting here for 4 hours, something happens at the facility, they will apportion the blame to us. But we need to come up with strategies to say in the facility, if we are not inviting OPM, who else can be invited to come and listen here? We are going to do that. And also, my intention is not to respond on anything. because I'm fearing a situation of, but as we are closing, Mama, ebo indaba kasisi lo, ndacela mntasekhaya ne, xa kuthiwa amen, walk to umama, so that today is the last day that you and your family are spending money to buy ARVs. You need to walk to mama and any other person who felt that their rights were violated. You must go to mama and report these things so that they can be resolved, because this is not a show of JJ Taban. Ku 403. Only JJ Tabane, who's hosting those shows, makes noise and nothing happens. You must be able to say the day you came to this meeting, your problems were listened to and resolved. We opened with a prayer. I will ask you, the national organizer, Comrade Moses Makombesan, to close this meeting for us. Whether you want a slogan or what, but come and close so that people can see you. Let's make sure, Mama, district has come, Moses. As Moses is coming forward, let's make sure man unnecessary fights and arguments, because this is all about the people. But if we are not getting any joy, we will be left with no choice to speak the language that we speak best. Over to your national organizer. So that they can see that you're going to lead the civil disobedience.
Mandla. Whenever you see me, if you are lucky to see my face, you must know that there's going to be a march. But we are not going to march, we are going to engage post this event. I just want to thank everyone again and to officially declare that this meeting is adjourned. Till next time. Thank you.